Ogera ku kirwadde ekya Pcos obango badde webuuza naye Pcos kitegeeza ki mweno live session tugenda kwogera ku Pcos. So Pcos simply means polycystic ovarian syndrome. Pcos simply means polycystic ovarian syndrome. Pcos kiba kitegeeza nti omukyala alina obuzibu obw'okuba nti ekisawu kye eky'amagi tukiyite the ovarian tissue kirimu obugi naye ng'ate obugi butono nnyo. Obugi obwo buba tebuli kukula bulungi. In Pcos, simply a woman with Pcos, she has a big ovary, or we call this an ovarian tissue, but the eggs are actually very small. We call these cysts. Pcos kiba kitegeeza nti omukyala alina obuzimba obutono nnyo ate ng'obuzimba obwo buli mu kisawu kye eky'amagi. Obuzimba obwo ebiseera ebisinga tebuba nti oba busobola okukula obulungi, nedda buba butono nnyo. In Pcos, normally those small swellings, they actually do not grow as a normal follicle could, as a normal egg could. Omukyala alina ekirwadde kya Pcos ebiseera ebisinga obugi buno obutono oba tebukula bulungi. Pcos simply means polycystic ovarian syndrome. Pcos kitegeeza polycystic ovarian syndrome. Poly kitegeeza ebintu ebingi. Poly means things that are many, and then cystic means small swellings. Okay, small swellings. Basically, these swellings are filled up with fluid. That's why they are called cysts. Okay, and then ovarian, basically it means that these small swellings, we call these polycysts, they are actually located on the ovary. Remember, the swellings could be located somewhere else, but in polycystic ovarian syndrome, oba mu kirwadde kya Pcos, buno obuzimba bubeera specifically mu kisawo kino ekibeeramu amagi. Syndrome is a collection of many symptoms. So omukyala amanya atya nti alina ekirwadde ekya Pcos? How can a woman know, or how can a woman confirm that she could actually be having Pcos? She actually has to go to a hospital near her. Kyala alina ogenda mu ddwaliro, and then waba atuse mu ddwaliro, dokita we ajja kuba amuyisaamu tests ez'enjawulo okukonfaminga oba mulimu Pcos oba temuli Pcos. When she goes to hospital, her doctor will do a proper evaluation to really confirm whether she is having Pcos or she's not having Pcos. Some of the basic checkups that could actually be done include an ultrasound scan. Mukyala wabanga agenze mu ddwaliro okukonfaminga nti alina Pcos, doctor we asobola okukolayoko ku checkup gye tuyise an ultrasound scan. Ultrasound scan eno eyinza okubeera either pelvic oba eyinza okubeera transvaginal, okay, nga bayita mu bitundu ebyekyama, oba nedda bayinza okuyita waggulu ku lubuto kye tuyise pelvic ultrasound scan. Era ebiseera ebisinga ultrasound scan eno ng'ekoleddwa ejja kulaga nti kino ekisawo ekibeeramu amagi mulimu obuzimba naye nga butono nnyo. The other way, or the other method by which Pcos can actually be confirmed is through blood tests. Now, these blood tests specifically, we begin with a simple blood test for sugars. We call this a fasting blood sugar test, whereby your doctor will check for diabetes or blood sugar disease, but normally this is in the morning before eating anything. Test endala doctor ojja okola okukonfaminga nti maybe oyinza okuba nga olina Pcos, yeno test eya sukaali gye tuyise the fasting blood sugar test. The other tests that could actually be done are actually hormonal tests. Hormonal tests. When I talk about hormonal tests, specifically the first hormone that is normally checked in Pcos is known as testosterone. Omukyala wabanga agenze mu ddwaliro bajja kukola scan gye tuyise ultrasound scan, naye ate basobola okukola ne tests ez'omusaayi okukonfaminga oba alina kino ekirwadde kya Pcos oba nedda. Tests ezisobola okukolebwa mu musaayi gwe okukonfaminga oba alina Pcos oba nedda, ze zino eza blood tests ze tuyise the fasting blood sugar test oba random blood sugar test, okulaba sukaali we ali atya. Normal alina kubeera 3.5 up to at least 6.5. though some laboratories give a reference of 3.5 up to 7. Omukyala wabanga badde alina sukaali ng'ali beyond 7 ng'ali mu 10 ebiseera ebisinga ayinza okuba nga ate sukaali waali waggulu, era mu luzungu tuba tugamba nti yandibanga atandise okufuna kye tuyise insulin resistance. Normally Pcos is a condition which is actually known to bring about what we call insulin resistance. Ekirwadde kya Pcos kimanyiddwa okuba nga ze zimu ku conditions ezitera okuleeta kye tuyise insulin resistance. Insulin resistance kiba kitegeeza nti omubiri gw'oyo omukyala gugaana okurespondinga ku effects eza hormone gye bayise insulin. Jjukira nti mu katundu ak'omubiri ke bayise the pancreas kafulumya hormone gye bayise insulin. Inside the woman's body there's what we call the pancreas. Even men, we do have the pancreas, but I'm talking about Pcos. Pcos is a woman's condition. So the pancreas releases a hormone known as insulin. Insulin is the hormone that actually converts glucose into glycogen. This is basically a store, just as you can actually plant maize and then you harvest the maize and then you keep it in the store waiting for the time to utilize it. Mu mubiri gw'omukyala mulimu akatundu kano ke bayise ka pancreas kafulumya hormone gye bayise insulin. Hormone eno gye bayise insulin ye converting glucose omungi mu mubiri gw'omukyala nebanga emutereka mu kye tuyise glycogen. Mu mukyala alina ekirwadde ekya Pcos, omukyala aba alina ekirwadde ekya Pcos, omubiri gwe guba gufulumya hormone eno gye bayise insulin, naye ate omubiri gw'oyo omukyala gugaana okurespondinga ku effects za insulin. Bwe guba gugaanye, jjukira insulin erina okukwata glucose emuteeke mu glycogen. So omubiri gw'omukyala alina Pcos bwe guba gugaanye okuba nga gukwatagana ne hormone eno, then kiba kitegeeza glucose agenda kubeera mungi. Omukyala amaliriza afunye kye tuyise insulin resistance. So Pcos kyekirwadde ekitera nnyo okutawanya abakyala whereby omukyala abeera ne sukaali nga mungi nnyo nga kiviira ddala ku mubiri gwe okugaana effects za insulin. Ekirala Pcos, omukyala abeera ng'alina Pcos ku kisawo kye eky'amagi, the ovarian tissue, kubeerako obuzimba nga butono nnyo bwe tuyise polycysts. Sign endala eya Pcos, omukyala wabanga badde alina Pcos aba agenda kubeera nekye tuyise irregular periods. Irregular periods kiba kitegeeza nti omwezi guno ayinza okulaba periods, omwezi oguddako n'ataziraba, omwezi oguddako n'aziraba, omwezi oguddako n'ataziraba. So sign endala eya Pcos oba sign endala eya Pcos yeno gye tuyise eya irregular periods. You can actually drop your questions. I'm going to answer your questions after. Yes, wabanga badde ina ebibuuzo byonna mukwano gwange yakatwegattako. Yes, teekako ebibuuzo nga maliriza guno omusomo gwaffe ngenda kubiddamu. Yes, and keep tapping on the screen so that many of our friends can actually join us here. Tapping on screen, mikwano gyaffe bajje batwegatteko twongere okubanga tumanya ku kye tuyise women's health. Okay, bampita Gerald Massa, the fertility coach. So the next sign of Pcos is irregular periods. Omukyala wabanga alina Pcos abeera nekye tuyise irregular periods. Irregular periods kitegeeza ki? Agenda mu nsonga ze naye ng'ate ziba zikyukakyuka. Bwe mba ngambye ndi ziba zikyukakyuka, leero nga 5 omwezi ogwa December 2025 waba agenze mu periods ze leero, okay, nga 5 omwezi ogwa December. Next month wabanga badde asuubira okugendamu nga 5 omwezi ogwa January 2026. Omukyala alina Pcos ate bino abatabikola ki? Abatatera abifuna. So of course mulimu abalina Pcos nga periods ziri normal, naye omukyala wabanga badde alina Pcos waba agenze mu periods leero nga 5 omwezi ogwa December, okay, kiba kitegeeza wabanga badde asuubira okulaba periods nga 5 next month wana ayinza okumisingawo. Then ate naddamu n'alaba periods ze. Yes, keep tapping on the screen. Keep tapping on the screen. So naddamu ate n'alaba periods ze maybe omwezi ogwokubiri 2026, maybe nga ate si 5 naye n'aziraba nga 2. Mu mukyala alina Pcos agenda kubanga alina kye tuyise irregular periods. Amisinga periods ze. Ayinza oziraba guno omwezi oguddako n'ataziraba then naddamu n'alaba periods. Oba nedda omukyala alina Pcos ayinza okulaba periods ze naye ate periods ezo n'azirwamu nnyo wiiki 2 ng'ali mu periods, wiiki 3 ng'ali mu periods. A woman with Pcos tends to actually have irregular periods, inconsistent periods, or she could actually have periods that are very heavy. We call this very heavy and very painful. We call this dysmenorrhea. Kyalo abanga badayina ekirwadde kya Pcos agenda kubeera ne periods ze nga ziri very heavy ate nga ziri very painful. Mu luzungu oba mu lwekisawo tukiyita dysmenorrhea. Tuli kwogera ku signs eza Pcos. Please keep tapping on the screen. Yes, keep tapping on the screen. So togedde ku signs eza Pcos, togedde ku irregular periods, togedde ku kuba nti scan eyinza okulaga nti alina obuzimba bungi bwe tuyise cysts, togedde ku kye tuyise insulin resistance. Omukyala atandise okuba nga omukyala alina ekirwadde kino ekya Pcos, sayini endala gy'asobola okubeera nayo yeeno gye tuyise phenotype changes. Bwe mba njogedde ku phenotype changes specifically mba ntegeeza endabika ye, appearance. Omukyala alina Pcos alabika atya? Oyinza okwebuuza naye musawo Gerald oyogedde ku Pcos, naye omukyala alina Pcos skin ye ebeera etya? Omukyala alina Pcos ebiseera ebisinga skin ye ebeera ne kye tuyise acne. Okay? Abeera ne pimples, abeera n'embalabe nga nnyingi nnyo. Of course nti buli mukyala alina Pcos abeera n'embalabe naye some of the abakyala abamu oyinza okusanga nga balina embalabe naye ate nga zino embalabe ziba zibatawanya nnyo ng'ate ne wakozesa lotions oba ne wakozesa creams ez'enjawulo ze bamuwadde mu pharmacy, embalabe ezo ziba tezigenda. Embalabe ezo ziba hormonal, ziba zivudde ku hormones. Oyinza okwebuuza n'ogamba nti naye musawo Gerald, embalabe zino eziba zivudde ku hormones kizooli okwogerako. Hormones zino mu Pcos baziyita androgens, ziba nnyingi nnyo. Androgens kiba kitegeeza hormones ez'abasajja. Omwana omuwala naye azaalibwa ne hormones ez'abasajja naye zirina kuba nga ntono. Hormones zenjogerako ze tuyise androgens mwe muli hormone gye tuyise DHEA, dihydroepian androsterone. Mulimu ne hormone emanyiddwa ennyo gye bayise testosterone. Okay? Nzo okwebuuza nti naye musawo Gerald, omukyala abeera ne hormone gye bayise testosterone. Yes, kituufu ku magi g'omukyala kuliko obutofaali obufulumya hormone eno gye bayise testosterone. Obutofaali obwo babuyita Defica cells, bufulumya hormone eno gye bayise testosterone. Hormone eno eba eyitiridde obungi, omwana omuwala ajja kubeera n'embalabe nnyingi. Omwana omuwala ajja kubeera, ndikosa ekigambo omwana omuwala naye omukyala ajja kubeera n'embalabe nga nnyingi ate nga tali mu myaka gino egy'obuvubuka. Mukyala mukulu, mukyala mufumbo naye ng'embalabe zimutawaanya. Embalabe zino ziyinza okubeera occasional nga zijja buzi ne zigenda, oba ziyinza omulinda mu periods ne ziba nga ziyiika, oba ziyinza okubeerawo persistently nga tezigenda. Omukyala abanga badde alina ekirwadde kya Pcos, hormone eno gye bayise DHEA esobola okubeera waggulu ate ne yeeyongera okuba nga emutaataaganya. And that's why ebiseera ebisinga si kirungi kulaba supplement gye bali okwogerako maybe wano ku social media n'odduka n'ogigula. Oyinza okugula supplement nga boostinga testosterone ate nga already obadde olina ekirwadde kya Pcos. Okay? Okuze supplement boostinga testosterone oba erimu ebirungo ebirinyisa hormone eno gye bayise testosterone oba erimu already DHEA ate n'ogikozesa ogenda okulaba nga ate owaseninga ekirwadde kya Pcos. N'okozesa supplements ez'enjawulo naye ng'oli kwongera okuwaseninga kuba mu supplement kennyini mwe muli ate ebiri okuba nga byongeza hormones zino. And that's why oba olina okwebuuza ku doctor wo then n'abanga akuguidinga ku kiki olina okuba nga okozesa. So togedde ku Pcos and we've talked about Pcos, we've talked about the signs. Njogedde ku signs eza Pcos, njogedde ku investigations oba tests eza Pcos okonfirminga nti omukyala alina Pcos. Kati tugenda kwogera ku ky'obujjanjabi obwa Pcos very fast and then tugende ku bibuuzo. I'm going to talk about the treatment oba the management of Pcos. Remember, my sessions are for educational purposes only. Live zange za kusomerako busomezi girabe bako kyoyiga and then yogera ne doctor wo ajja okuwa kye tuyise a personalized care plan oba ajja okuteeka ku treatment nga yogwe kennyini. So the point is this: when you are looking at the management of Pcos oba mukujjanjaba Pcos, kiri very simple. First of all, olina okuba nga ogoberera the therapy oba olina okuba nga ogoberera treatment ya doctor wo gy'aba akutaddeko, kuba jjukira abeera ne tests ze yakukozeeko ze yasinziddeko ne proper assessment eyo gy'aba akukozeeko then n'agamba nti kati ogenda kukozesa lino eddagala oba ogenda kukozesa lino eddagala. So the first step olina okuba nga ogoberera doctor wo ky'aba akugambye. Okay, follow your doctor's treatment plan. complementing on the doctor's treatment plan, what your doctor has given you, oba okwongerezaako doctor wakyaba akugambye, olina okumakinga sure nti otunuulira ku kye tuyise weight loss. Nzo of course mulimu abakyala abalina ekirwadde kya Pcos naye nga ate si banene. Okay? Yes, mulimu abakyala abalina ekirwadde kya Pcos naye nga si banene. Naye the biggest percentage y'abakyala abalina Pcos ebiseera ebisinga osanga nti oyinza okusanga nga tebalina issues ne weight gain. Ebe batawanya nnyo, so you should consider losing weight when you have Pcos. Obanga olina ekirwadde kya Pcos, tunulira okulaba nti osala ku weight yo. Omanya otya nti olina weight eya waggulu, olina okukola kye tuyise body mass index tracking oba checking. Ojja genda ku simu yo ku Google Play, kuliko obu apps obuliko ekigambo kino BMI. Okay? BMI calculator, whereby bajja kugamba nti space eno teekamu kilo zo, olina kilo meka. Oba olina 10 ng'oteekamu 100 kilograms. Then ku space eno bajja kugamba teekamu your height. Okay? Height ogipima otya, olina ogenda mu pharmacy ekuli okumpi, oba balina akagundi kana akapima height obuwanvu bwo, then nowepima, oba oli 5 feet oba 6 feet noteeka muno, then nonyiga enter. Oba okoseza app, okay? There's a calculation for it. Then app ejja kugamba nti BMI yo oba body mass index yo eri weight. Normal erina kubeera 18.5 up to 24.5. The normal body mass index is supposed to be 18.5 up to 24.5. So wokola yo BMI check oba body mass index ngobadde olina ekirwadde kya Pcos, olina okuba nga ogwa wano. Wosuuka 24 n'obutundutundu 5 n'oba nga oli mu 3, kiba kitegeeza oli kye tuyise obese, weight eba waggulu nnyo, whereby olina okuba nga oluzinga weight. Next, olina okulaba coach wo akuli okumpi when there's a gym, then ajja kuguidinga ku aerobic exercises ez'okuluzinga weight. Of course, mwe muli okubanga osobola okukola jogging, okay? Kola duiro, but when you're doing jogging, the graph is like this. Olina okutandika mpola ng'okolayoko ku jogging eri very simple, kutambula, walking, oba okolayoko okudduka like maybe 1 lap, oba n'okwegamba otandika n'okutambula, n'ogenda ng'oyongeza ka speed, n'ogenda ng'oyongeza ne distance gy'okola ki. So basically when you're embarking on jogging or aerobics, you should begin from 0, okay? Then go on building gradually. Do not force your body, do not force your system, do not force your heart to do intense exercises. It could actually be disastrous. Togenda mu gym n'ogamba nti katogenda okukola exercises zonna zimaleyo. Togenda mu gym n'ogamba nti kata togenda kusitula ebyuma byonna bimaleyo. Olina okuba nga okola exercises in moderation, okay? At least kirina kubeera for only 30 minutes. Wosuuka dakika 3 ng'okola duiro, ate ng'olina ekirwadde kya Pcos, ebiseera ebisinga ate oba ogenda ku overworking omubiri gwo, of which oba ogenda kufulumya hormone eya stress nga nyingi nnyo gye bayita cortisol. Hormone eno eyiika nnyo ng'okoze duiro ate n'oyitiriza. So cortisol ate waalinnya. Cortisol hormone weerinnya because of over-exercising. Then ate cortisol hormone eno esobola okukombininga ne hormones endala ate n'osanga nga ate Pcos okubanga egenda ate yeeyongera bweyongezi. So do exercises in moderation, okay? So tuli kwogera ku management of Pcos. We are talking about the management of Pcos, and we've said that you have to look at, follow your doctor's treatment plan, look at losing weight. How can you know that you're overweight? You do the body mass index tracking. You can get the app on Google Play on your phone, and then you will know how to calculate your body mass index. The next step in managing Pcos, how can you manage Pcos? Let me go slowly. How can you manage Pcos? So the next step in management of Pcos is you actually have to look at your diet. Omukyala alina ekirwadde kya Pcos ayinza okwebuuza naye ate kati musawo nze ndina Pcos nkoze ntya okubanga mu managinga. Oyinza okozesa empeke n'omira buli mpeke yonna yonna n'ogimalayo naye nga Pcos tali ku stabilizinga, okay? Yeah, Pcos normally has to be stabilized. Normally it is actually a chronic condition, but it can be stabilized and a woman can get pregnant even though she has Pcos. So you have to look at what you're eating. Olina okutunuulira biki by'oli okulya. Omukyala alina Pcos talina kulya mmere eri kye tuyise erina kye tuyise high glycemic foods. Oba tolina kulya mmere egwa mu kika kye tuyise high glycemic food category. Emmere eri high glycemic food category oba emmere eri high in sugars ze tuyise the carbohydrates, okay? Carbohydrates. Emmere eri very high mu zino sugars eziri refined, okay? Nga of course mwe muli kye tuyise ekirungo kino kye tuyise carbohydrates, okay? Emmere eyo mwe muli kye tuyise emigaati, omukyala alina Pcos alina okendeza ku migaati togirya nnyo singa kiba kisoboka osobola okusooka n'ogyesonyiwamuko naddala ng'obadde ogezaako okufuna olubuto kuba oyinza okumira empeke eza Pcos nga teziri kuyamba just because by'oli okulya bye biri okuba nga ate biwaseninga condition yo. Jjukira high glycemic foods zongeza kye tuyise inflammation mu mubiri gw'omuntu, so oba olina Pcos inflammation eyinza ate okuba nga ate ewaseninga kino ekirwadde. So omukyala alina Pcos alina okuba nga at least akendeza high glycemic foods mwemuli emigaati, mwemuli cakes, mwemuli n'emmere eri prepared naddala bino ebintu biri prepared nga biri nnyo mu supermarkets. Okay, ebintu ebibatera okutunda mu supermarkets nga biri prepared ebyo cakes, omuli chapatis, omuli ebintu ebyenjawulo. Omukyala alina Pcos alina okubikendeeza. Omukyala alina Pcos alina okuba nga embarkinga ku diet gye tuyise Mediterranean diet. Kyamanyi gwe mukwano gwange ali ku live eno olina smartphone nga tumaliza live session yaffe genda osome ku kye tuyise Mediterranean diet. Mediterranean diet egamba ki? Mediterranean diet kiba kitegeeza nti omukyala alina okulya kye tuyise plant-based foods. Plant-based foods kiba kitegeeza nti alina okulya at least obumonde obwo bulungi nnyo. Omukyala alina Pcos ne wali obumonde omwaka gwonna ajja kuba abeera bulungi nnyo. Pcos ye tejja kuwaseninga. Omukyala alina Pcos alina okuba nga at least alya ku matooka ago. Okay, whole foods nga wegavudde mu nnimiro osobola okuganyiga obunyizi oba osobola okufumba amatooka ag'eminwe. Okay, a woman with Pcos should opt for a Mediterranean diet which actually includes plant-based foods. Omukyala alina Pcos alina okuba nga at least fruits zibeera part of her. Fruits alina okuba nga alya ku fruits nnyingi nnyo. Fruits mba njogera ku micungwa, oranges. Oba talina ulcers, obanga obadde olina ulcers tolina kulya ate emicungwa kuba girimu kye tuyise ascorbic acid ate asobola okuba nga awaseninga ulcers zo. So naye nga oba tolina ulcers lya ku fruits ez'enjawulo omuli emicungwa, okay, emicungwa, omuli obutunda, passion fruits, and then of course oba olina Pcos gezaako okulaba nga at least olyako ne ku watermelon. Okay, tolya watermelon namba naye at least olunaku olina okulyayoko ku watermelon. Then oba olina blender ng'osobola okukola juice, okay, osobola okujuicinga watermelon n'oteekamuko maybe ku micungwa oba n'oteekamu ne ku fruits ez'enjawulo omuli maybe osobola okunyingamuko ne ku lyenvu n'oteekamuko ne ku cabbage. Eyo gye tuyita a Mediterranean diet. Very very effective mu mukyala alina Pcos. Oba olina Pcos naye nga tova ku migaati, olina Pcos naye nga tova ku cakes, olina Pcos naye nga tova ku chapati, olina Pcos naye nga tova ku Rolex, okay, oba ogenda kuwaseninga buwaseninzi embeera. Sigambye nti ove ku Rolex naye amagye ago mu mukyala alina Pcos osobola ogafumba obufumbi. Okay, boiled eggs. Olina okuba nga oli amagi naye nga ate gaba mafumbe. Mediterranean diet at least ebeeramu amagi amafumbe, ebeeramu fruits nga nyingi, ebeeramu whole foods oba kize tuyise plant-based foods nga wezivudde mu nnimiro. Obumondo obujje mu nnimiro butokose oba bufumbe bulungi busavinge lya. Okay, then of course greens. Mukyala alina Pcos alina okuba nga alya ku greens nungi nnyo mwemuli nakati, mwemuli sukuma wiki, mwemuli ejjobye, mwemuli greens zonna z'osobola okufuna gwe wooli wonna oba oli wano waffe e Uganda nga toli wabweru w'eggwanga, greens osobola ozifuna. Naye obanga obadde oli wabweru w'eggwanga era still osobola okufuna greens mu butale oba bukuli okumpi. So oba olina Pcos, it's not about okumira eddagala. It's not about eddagala lyokalyoka nti oba oli ku metformin, oli kumira metformin, and then of course oli kumira like kye kirala mu Pcos, oli kumira metformin and then maybe oli kumira maybe eddagala lino erinjawulo erikosebwa mu Pcos. Okay, zimayo inosto, dichiro inosto, osobola obikozesa ebyo byonna naye ate olina okutunulira ennyo kye tuyise a holistic approach whereby olina okuba nga at least obeera ku kye tuyise a Mediterranean diet. I think that's enough about Pcos. Njogedde ku Pcos nenjivunula, then nenjogera ku signs, njogedde ku tests, nengamba nti tests eza Pcos mwemuli okola anal ultrasound scan, and then I think that's about Pcos. Woba olina ebibuuzo byonna ku Pcos mukwano gwange buuza, zino ziri ssaawa 11 zigenda 12, zirina okuwunzika ku ssaawa 12 zennyini, so kampite mu bibuuzo. Jjukira bampita Gerald Massa the fertility coach. Wabanga obadde olina ebibuuzo byonna buuza, nja kuba nkuddamu. Yes, I'm waiting for questions. Today's topic was Pcos. Leero njogedde ku Pcos. and I'm waiting for questions. Buuza ebibuuzo byonna byolina. Oyinza okubuuza ebibuuzo ku Pcos, oyinza okubuuza ebibuuzo ku mbeera endala yonna. So, okay, seems like there are no questions. Okay, then let me welcome December baby. You are most welcome. Nkwaniriza Prosi, Eugene, nkwaniriza Maleka, nkwaniriza, and then Sunday Sebuliba, nkwaniriza Jacob, nkwaniriza ku live session ya feno ya lero. Okay, then we have a question coming in from our friend, and okay, the names are not there. Me, I have no signs of Pcos. I did every scan and blood tests, nothing is found and seen, so I have pain. Mukwano gwa fabuza nagamba nti talina signs za Pcos. Talina signs zonna eza Pcos. Jjukira njogedde ku Pcos neŋŋamba nti sign esooka eya Pcos omukyala abeera ne kye tuyise irregular periods. Okay? Then omukyala abeera ne kye tuyise insulin resistance. Omubiri gwe gubeera ne sugars nga nyingi. Why? Because insulin teweebwa chance kubanga ekendeza sukaali oyo, so abeera ne sukaali mungi. And then of course omukyala alina Pcos abeera ne kye tuyise androgenesis oba abeera ne hormones ez'abasajja ze tuyise androgens nga nyingi nnyo. Of course kyekiviirako kubanga afuna embalabe n'afuna ebirevu n'afuna futures ez'abasajja eddoboozi ne likyuka. That is Pcos for you. So mukwano gwaffe agambye nti she does not have any signs of Pcos. Yakola tests zonna naye ate okay, she did every tests, scans and then blood tests, but she still has pain. Ali kwebuuza aligamba naye akyalina obulumi. Ali kwebuuza obulumi buno buli kuva ku ki? So of course mukwano gwaffe taspecifyinze wa obulumi buno we buli. Okay? Either oba buli mu bitundu ebyekyama oba muli mu side ez'enseke oba buliwa. Mukwano gwaffe abuuza kino ekibuuzo mbadde nsaba okomewo o specifying buno obulumi buliwa. Okay? She said that she does not have any signs of Pcos, but she has pain. She's asking what could be the cause. So njagezako kubanga ngenda in deep, okay, wadde taspecifyinze naye njagezako okwogera ku system ey'omwana omuwala ey'omukyala. Omwana omuwala ng'azaliddwa mu nsi abeera n'abaana geri wet erina shape eno, that is the normal. Guno gwe mumwa gw'anabaana, then bye bitundu by'ekyama. Munda muno mulimu line eyitamu wet. Kuno omwana kwe yekwata n'akula okumala emyezi 9. Line eno webanga yayiikayiika olwa infections ezitawona olwa hormones okubanga tezibalansinga, buli lubuto olugendamu lwe luyiika. Kyetuyise repeat pregnancy losses. Naye leero tuli kwogera ku Pcos. Then of course side eno wewali oluseke. Then of course tukimanyi bulungi nti oluseke luno lulina part ennene eringa ekoona. Part eno gye bayita the ampullary part of the fallopian tube. Ejiwe liba livuddeyo lijja ne lituula wano ne lirinda kwasa ez'omusajja, then omwana n'afoominga. Omwana afoomingira mu luseke wano. Part eno eringa omukono ku luseke olw'omukyala gye bayita the fimbrial part of the fallopian tube. Kino kisawo ekibeeramu amagi. Then neno nayo same thing. Then kino kisawo. Mukwano gwaffe tabutubuulidde exactly pain eno eriwa. Mbadde nsaba okomewo ku live session yaffe eno obuuze. Please try to ask your question like more specifically where are you feeling the pain. Okay? Agambe talina signs zonna eza Pcos. Talina irregular periods, talina insulin resistance, talina hormones ez'abasajja ennyingi ne hormones bazichecking agambye buli kimu kiri normal naye awulira pain. So assuming that the pain is on this side here, on the right side, then kiba kitegeeza nti obulumi obuyinza okuba nga buva mu nseke oba buyinza okuba buva ku side eno ey'ekisawo eky'amagi. Obuyinza oyinza okusanga maybe mulimu ekizimba oba enseke zirimu amazzi. Okay? Then of course pain webeera wano mu makati wansi w'ekundi lirino wano waggulu, then nabaana yiino. Obulumi buyinza okuba nga butegeeza nti either mu nabaana munda mwe muli obuzibu oba nabaana kennyini eri affected. Okay? Nzo wano of course tuli mu kusoma busomi naye mbadde nsaba okomewo o specifying exactly pain eriwa. Okay, so okay. I'm not seeing any questions. Kulio. Yes, Kulio ogamba ki nkwaniriza ku live session yaffe eno. Yes, mukwano gwaffe Kulio, mama w'abaana ali atya? Subire nti ali bulungi, mugambe mutumidde nnyo Kulio. Yes, so okay. No questions. Okay, there's another question coming in from user 9732. I have a copper IUD in situ for 1 year. Now. I'm late by 5 days. Is it normal? Okay, then we shall use this. Mukwano gwaffe agambye nti alina ka copper IUD, alina kano ka family planning akaweta ke bateeka wansi kamazemu omwaka mulamba oba akamazeeko omwaka mulamba and she's late by 5 days. Okay, mwaka mulamba and then of course kayiseeko ennaku 5 and then ali kwebuuza nti I'm late by 5 days, is it normal? If at all you're late by 5 days, actually this is actually within the normal ranges. You could actually go back and then they could advise you on the next steps to take. Either they could remove it or they could they could actually remove it and then maybe advise on the next step. So visit a family planning clinic near you for a proper assessment. Mukwano gwaffe agambye nti alina akaweta baakateekamu kano ka IUD, kakopa IUD kali munda muno naye nga ali kwebuuza ayisizaako ennaku 5 nga kano akaweta gye kali munda mu n'abaana. Okay, bakateeka around here. Okay, kalina pattern eri bwet bakateeka around here. So ali kwebuuza kiri nomo okubanga kayisizaako ennaku 5 oba nedda. Ne ngamba nti kano akaweta kebateeka mu bitundu ebyekyama bwe kaba kabadde kayiseeko ennaku 5. Ennaku 5 ntono nnyo. Of course tegeka oddeyo mu family planning clinic gye bakuteeramu akaweta ako oba eddwaliro erya gavumenti erikuli okumpi, then bajja kukola a proper assessment omuli an ultrasound scan okulaba kakyali mu position oba kasesetuka, and then of course afterwards bajja kuba bakubuulira ekyokukola, either okajjamu then babeere nga ate bakugaidinga ku kiki ennyini ekirala ekirina okuba nga kiddibwako. Maggi wa Shiba, lwaki nfuna white discharge ate nga mpulira amabeere gannuma n'omugongo? White discharge ate nga mpulira amabeere gannuma n'omugongo. White discharge and she has pain. Okay, so the question is about our friend. She's called Maggie. Yes, Maggie wa Shiba. Nkwaniriza kusanyukiddeko Maggie wa Shiba, webale kuwagira channel yaffe Gerald Massa the fertility coach. So ogambye nti ofuna white discharge ate nga owulira amabeere gakuluma n'omugongo. White discharge, alina nekyetuyise back pain, and then of course n'amabeere nago gamuluma. Ali kwebuuza ku lwaki kino kiri wekiti. Okay, alina white discharge, alina back pain, omugongo gumuluma ate n'amabeere gennyini gamuluma. Ali kwebuuza ku lwaki kino kiri wekiti. Nze of course mukwano gwaffe Maggie tagenze in deep okubanga atuconfirmingira whether yamisinze periods ze oba nedda. Okay, agambye alina white discharge, ebintu ebya white bivaayo wansi, and then n'omugongo gumuluma n'amabeere gamuluma. The next question is, singa tubadde like maybe oli live nandibadde nkubuuza nti periods wazirabye oba nedda? Obanga wamisinze periods zo ate nga olina discharge eri okuvaayo, of course discharge eyinza okulaga ebintu bingi. Eyinza okulaga nti maybe olina ka infection, okay, akeetaaga okukeberwa nga bacekinga omusulo oba nga bakola test gye tuyise a high vaginal swab HVS. Naye ate omugongo okubanga gukuluma n'amabeere okubanga gakuluma, oba omisinze periods zo, badde nsaba gumiikiriza at least week emu, 1 week okole ka test ak'olubuto kebayise the urine HCG pregnancy test. Osobola okukolera ewaka oba nedda osobola ogenda mu ddwaliro ne bakola test ey'olubuto ey'omusaayi gye bayise the serum HCG pregnancy test. You can either do the urine HCG or the serum HCG. That is after missing your periods if you do have these signs. Oba nedda obanga walabye periods zo, kono gwaffe Maggie yabuuza kino ekibuuzo, oba olabye periods zo naye nga maybe wavuddemu jjo oba wavuddemu nnaku 2 mabega ng'olina this white discharge n'omugongo nga gukuluma ne breast pain, then kiba kitegeeza nti nabannayo at first yali emanyi nti maybe ofunye olubuto naye just because tiwafuna olubuto n'olaba periods, then hormones ezaayiika ng'oli mu kulaba periods oba ng'onaatera okugenda mu periods, hormones ezo ze bayita actually they're not hormones, they're chemicals, sorry. Chemicals ezo ezaafuluma baziyita prostaglandins, ze zireeta pain eyo. Chemicals ezo oba wakamaliza periods ziba zikyali mu system yo, ziba zikyali mu kyetuyise yo pelvic region, ziba zikyeyongera okuba nga zireeta pain eyo. Osobola ogendako mu ddwaliro erikuli okumpi oba mu clinic oba eddwaliro erikuli okumpi, then bajja kusobola okumanaginga pain eno, bamanaginge n'omugongo okubanga gukuluma. That is obanga walabye periods. Obanga tewalabye periods topapa kuba nti ate omira kino oba omira kino, gezaako okulaba ng'osooka okukonfaminga oba wafunye olubuto oba nedda ng'okola test ey'olubuto gye bayise the serum HCG pregnancy test oba the urine HCG pregnancy test. Kana ak'omusulo osobola okukakolera ewaka kangu nnyo. Osobola okulagira ku pharmacy ng'oguze kagundi ako. Eno serum HCG togikolera waka, eno eba ya ddwaliro. I think that's the best answer I can give right now about that question. So we shall move to the next question. Mkwano gwaffe omulala. Okay. No new questions. Okay. Yes. So remember, I'm called Gerald Massa, the fertility coach. Bampita Gerald Massa, the fertility coach. Wabango bado inebuza bikwatagana ku fertility. One day taze guidance, one day taze answers ku issues za fertility. Buuza nja kuba nkuddamu. Yes. So ngeza ko kunoonya ebibuuzo ebipya. Kuyaba tewali bibuuzo ngenda kuddamu mu Pcos njogereko ate. Mbadde nikwogera ku Pcos ne ngamba nti Pcos kirwadde. Era ekirwadde ekyo specifically kibeera evidenced by omukyalo okubanga alina obuzimba bungi nnyo, obuzimba obwo bubeera mu kisawo kye eky'amagi. And then of course nengamba nti Pcos eyo ebiseera ebisinga omukyala abeera ne hormones ez'abasajja. Okay, abeera ne hormones ez'abasajja ze bayise androgens nga nnyingi nnyo, era hormones ezo ez'abasajja zireetera omukyala okubanga afuna challenges nnyingi nnyo. Hormones ez'abasajja mwe muli hormone gye bayise testosterone, and then ne hormone gye bayise DHEA, dihydroepiandrosterone. Hormones zino ziviirako omwana omuwala okubeera n'ebirevu, ziviirako omwana omuwala okubanga afuna kye tuyise subfertility oba okufuna olubuto n'abanga afuna obuzibu. Nengamba nti Pcos okugijjanjaba olina okugoberera advice doctor wo gyaba akugambye. Okay, olina okubanga ogoberera advice doctor wo gyaba akugambye. Naye ate nengamba nti kirungi nnyo n'obanga oluzinga ne ku weight, kirungi nnyo n'obanga obeera ne body mass index eri between 18.5 up to 24.5. Kirungi nnyo okubanga otandika ku dduyiro n'okola jogging, okay, n'okola aerobics ez'enjawulo omuli okubuuka akaguwa. Tandika mpola oba olikola dduyiro, totandika ku speed n'ogamba nti kati ogenda kubuuka 1000 nedda. Tandika mpola, buukayo leero 5, enkya 10, enkya 2, like that. Buy a skipping rope when you have Pcos, and you should only exercise for only 30 minutes. Do not exceed 30 minutes. When you go beyond 30 minutes, then your body is going to produce a hormone for stress known as cortisol, which could actually worsen your Pcos. Why? Because the hormone known as cortisol is going to travel in your bloodstream, go to the brain, and then interfere with the production of the two hormones, that is FSH and LH. Kokola dduyiro n'aba mungi nnyo, omubiri gugenda kuba gujjuddemu hormone eno gye bayise cortisol. Cortisol hormone is a stress hormone. Okola dduyiro obeera nga ali okustressing omubiri go, much as obanga okoze within 30 minutes omubiri go gugenda kuba gubeera ne cortisol production naye egenda kuba ekendeera. W'osuuka saawa namba oli mu gym, saawa 2 oli mu gym, wagenze mu gym ku makya tonavaayo like paka maybe emisana, omubiri gugenda kufulumya cortisol hormone, and then of course cortisol hormone egenda gamba obwongo nti toleta FSH, toleta LH. Zijjukira zino ze zikuza amagi. Oyinza okulaba nga omira mpeke okola buli kimu naye nga toli kutereera just because you are over exercising. So with Pcos, exercise for only 30 minutes, and specifically aerobics. Don't lift heavy things when you have Pcos. Next, I talked about the management of Pcos. Nengamba nti omukyala alina Pcos alina okendeeza emmere gye tuyise high glycemic foods. High glycemic foods mwemuli emigaati, mwemuli cakes, mwemuli Rolex, mwemuli chapats. Olina okubanga obikendeza oba olina Pcos. Then nengamba nti olina okubanga at least obeera ku kye tuyise Mediterranean diet. Eri made up of plant-based foods. Emmere evudde mu nnimiro. Lumonde, obumonde, nakati, sukuma wiki, okay? Emmere evudde mu nnimiro, muwogo aba mulungi nnyo naye toba tolya. Mungi nnyo kubeera naye abeeramu kye tuyise carbohydrates. So togedde ku bintu bingi ebya Pcos, nenjogera ku signs za Pcos. Mukwano gwaffe n'abuuza nti alina a white discharge, back pain ne breast pain. Nengamba nti waba yamisinze periods then akabera olubuto, wabanga yalabye periods then kiyinza okuba nga kiri kuva ku kye tuyise prostaglandins oba nedda hormones ezayiika nga anaatera ogenda mu periods. Next question is coming in from God is Great, and Musawo, I buy a test of HIV malaria genes, but line up to what does it mean with one? Yeah, God is Great. Your question is actually not clear. You said that you did some tests for HIV and then malaria, but the results are unclear. Best advice is you actually need to go to a hospital near you for a proper checkup, for a proper testing. If you want to test for HIV, please go to a hospital near you and then let the doctors do the tests for you. Why? Because you could do the tests and then get false negative results, which could actually cause more issues. Okay, mukwano gaffe agambye yakebedde HIV, yakebedde omusujja naye ebivuddemu tali bitegeera, ali kwebuuza kiki kyennyini kyalina okuba nga akola. Ne mugamba nti agende mangu mu ddwaliro erimuli okumpi. Yes, and then of course bajja kukola tests zino eza malaria n'omusujja, and then of course bajja kuba bamubuulira biki byennyini ebiba bivuddemu. Okay, bwe tuba tuli kwogera ku HIV tests mulimu tests ez'enjawulo. Oba ogenze mu ddwaliro dokita wo ayinza okuba nga ate akusooka n'akola kye bayise a pre-test counseling session. Okay, why? To prepare you abagenda kutegeka, because HIV ebigenda okuvaamu mu results ezo biyinza okukyusa obulamu bwo obusigadde ku nsi. So alina okuba nga bakola kye tuyise pre-test counseling, okutegeka kulwaki osazeewo okola test eno, ebijja okuvaamu ojja bigumira, oba ojja kukkiriza, oba ojja ku will you accept the results. Okay, and then what is the way forward after getting the results for HIV. Malaria teetaaga counseling. Okay, and then of course nengamba nti bajja kukola ne kye tuyise post test counseling. Oba omaze okufuna results eza HIV bajja ku counseling after getting the results, and then afterwards bajja kuwa results ezo bakuguidinga ku step ki egenda okuddako. Tobera mu nyumba yo n'ogula strips n'ogamba nti okebere HIV nedda, genda mu ddwaliro kuba waliyo abasawo abakugu. Genda mu ddwaliro erikuli okumpi, waliyo abasawo abakugu be tuyita ba counselors abajja okuba nga basooka ne bakucounselinga ne bakutegeka, and then of course waliyo n'abasawo bennyini abali qualified abajja okukola tests eza HIV obulungi mu ddwaliro under controlled environments. Okay, tests ezimu ezisobola okuba nga zikolebwa eza HIV mwe muli eneetandikibwako gye tuyise eya start pack. Then of course waliwo ne gye tuyise eya determine. Then of course singa results zivaayo nga teziri conclusive, okay, ziri kulaga nti wamwali oba taliimu oba teziri clear, then basobola okukola eno gye tuyise eya Unigold. And then of course still wekiba kyetaagisa nga era results zikyalimu okwo akabuuza, then basobola okugenda mu maaso ne bakola eno gye bayise eya PCR, polymerase chain reaction test for HIV. Era still results eziba zikyabuuzibwa, then basobola okukola eno gye bayise eya ELISA, enzyme linked immunoassay suppressant something. Okay, so bana abalab abasaba abalab baba bimanyi bino byonna. That's why ngambye nti olina ogenda mu ddwaliro ne baba nga bakola proper tests. Batandikira ku kana ka start pack ne bagenda wano ne bagenda wano ne bagenda wano, maybe ne bamaliza na wano. Okay, why? Because mu ddwaliro baba basobola okukola bino byonna. Obeera mu nyumba yo n'okola test ya HIV bino byonna oba tobirina, unless nga maybe wazimba eddwaliro mu maybe like ng'olina eddwaliro ewaka ng'olina bino byonna, naye the best is genda mu ddwaliro erikuli okumpi bakole tests ezo. Mukwano gwange abuuza ku HIV tests then ne malaria tests. Okay, oyinza okugula ka strip ak'omusujja ne kalaga nti tekali reactive, kana ak'omusujja ne kalaga nti line erimu emu naye ng'omusujja mweguli. Why? Because ensiri weruma omuntu, this is the skin, ensiri ino wekuluma leero akawuka kana k'omusujja kagenda kumala weeks 6. Okay, 6 weeks nga kakyazaala nga kakyali mubiri gwo nga kakyatambula, kalina okugenda mu kibumba. Okay, the liver, the malaria parasite kalina okugenda mu kibumba ne katandika okuba nga ka-creating oba nga kazaala obulala obungi ennyo, and then afterwards ne buvaayo ne butambula mu mubiri gwo, then ne buleeta kye tuyisa omusujja. Musawo omubiri gunnuma, musawo joints zinnuma, musawo mpulira omutwe gunnuma, that is kiba kitegeeza kaba kavuddeyo mu kibumba akawuka ak'omusujja nga kati kali kutambula omubiri gwo gwonna. Of which ne HIV virus nayo kennyini erina different periods eza gundi ze tuyise incubation oba window period okuvaayo ne katandika okutambula mu mubiri gwo. So the best advice for proper lab testing, genda mu ddwaliro erikuli okumpi bakukebere, bajja kuba bakuguidinga. Elizabeth ogambye nti thank you so much, you always respond to me on WhatsApp. Yeah, thanks a lot Elizabeth for the appreciation. I'm so humbled. Yes, so mukwano gwaffe abuuziza nti is prednisolone good in early pregnancy if I have a history of preeclampsia? Yes, Elizabeth, I'm doing the live session in English and in Luganda. Hope you are okay with that. We have our friends who are okay with the English language, and then we have friends who are okay with the Luganda language. Mukwano gwaffe agambye nti empeke zino eza prednisolone nungi mu mukyala wabanga badde alina ekirwadde kye tuyise preeclampsia. Preeclampsia kiba kitegeeza nti alina kye tuyise blood pressure ate nga ali lubuto. Ayinza okuba nga yakatandika butandisi obanga ekuze nga ina pressure, nga yakatandika butandisi obanga pressure ekuze. So abuuza n'agamba nti empeke zino eza prednisolone nungi mu mukyala alina pressure mu lubuto oba nedda. Nengamba nti advice esookera ddala mukwano gwange Elizabeth ya ku making sure nti osooka mu ddwaliro ne basooka ne bakola a proper check up okukonfaminga pressure yo eri mu stage ki. oyinza okusanga nga pressure eri mu stage esooka oba stage eyokubiri oba ngeri mu stage eyokusatu. Prednisolone tejanjaba pressure. Prednisolone is actually a steroid medication. Eddagala lino lye bayise prednisolone eddagala ligwamu kye tuyise steroids. Okay? Specifically prednisolone ekoozinga oba ereeta kye tuyise anti-inflammatory activities oba eziiza inflammation okuba nga etekinga place. That's why mu bantu abalina obulwadde bwa asthma babawa prednisolone. Why? Okukendeeza speed asthma gyali okutambulirako oba gyali okuleetera amawuggwe okuba nga gaziba. Okay? Prednisolone is a steroid and it is an anti-inflammatory. Of course it has other functions. Okay? Naye the point is this. Waliwo ensonga lwaki baba bakuwadde prednisolone. No. Of course tukimanyi bulungi nti steroids ezimu nga Dexa, Mifazone zikozesebwa mu bakyala abalina embuto. Of course zirina kuba nga zikuweebwa dokitawo okuyambako okulaba nti omwana ono akula bulungi n'amawuggwe g'omwana kuba nga gakula bulungi. Naye the best advice is Elizabeth, go to a hospital for a proper check-up to really confirm the blood pressure in pregnancy is at which level, because tukimanyi bulungi nti blood pressure normal erina kubeera at least 100 paka ku 100. This is a high normal, and then of course eya wansi erina kubeera 6 paka ku 9. Okebera pressure readings ne ziraga nti oli mu 130 wansi ng'oli mu 6. Yeah, 130 ebetandise okulinnya, naye ate the point is oba oli within the normal. Naye okola blood pressure check-up oba okeberedde mu clinic oba olina akuuma aka pressure ewaka ne kalaga nti oli mu 17 wansi ng'oli mu maybe 10, wano kiba kitegeeza nti pressure mweri ate eri waggulu. Oba oli lubuto wano tuba tweraliikirira nti eyinza okuviirako okuba nga olubuto luvaamu miscarriages, eyinza okuviirako omwana okukula ng'alina obulemu kye tuyise congenital abnormalities mu baana, eyinza okuviirako omwana okuggwako amazzi kye tuyita oligohydroamnios, eyinza okuviirako conditions nyingi nnyo n'omwana okuzaalibwa ng'obulamu tebuliiwo. So the point is, genda mu ddwaliro mukwano gwaffe Elizabeth bakole a proper assessment on you, and then bakole kye tuyise a proper staging of the blood pressure. Oli mu stage esooka, stage eyokubiri oba stage eyokusatu. Bajja kumanaginga pressure eno n'eddagala sigenda alyogera wano ku live. Bajja kumanaginga pressure yeterere bulungi, and then of course wabanga obadde oli ku prednisolone for something like maybe asthma or any other condition, then naye doctor asobola okugamba nti kati yongerako neno naye nga yongerako doozi bweti. So in summary, genda mu ddwaliro erikuli okumpi, then babeere nga bakujjanjaba. In English, she asked a question and she said that she actually she's on prednisolone, and she's asking, is prednisolone good for pre-eclampsia, or is prednisolone good for women who have high blood pressure and they are pregnant? And I said that the first step is that she has to go back to hospital for a proper checkup, for a proper staging, to really confirm at what stage is the blood pressure at. Okay, if at all it is in stage 1, just around 140/90, maybe 140 something, 148 over maybe 90 something, okay, high normal, then advice will be given. If it is in stage 2, still they will manage her. The best advice is she goes to hospital, and then they will be able to assess. Then after an assessment or after a proper checkup, they will put her on medications to stabilize the blood pressure, and then afterwards the prednisolone, whether it's being given for a chronic condition like asthma or any other condition that necessitates the prednisolone, then advice will be given. I hope I've answered this question for Elizabeth, and let me go through the next questions. Elizabeth, thanks a lot for asking the question, by the way, but go to hospital, genda mu ddwaliro mukwano. Yes, and then addiction. Okay, hey Mosau, hello, how are you doing today? Mary, you are most welcome. Nida, thanks for joining. Okay, next question is coming in from a friend, and she's saying that I want to get pregnant, but I see my periods twice a month. What could be the problem? Fantastic question. What's the time? It's approaching 6. Okay, so she actually wants to get pregnant, but she sees her periods twice a month. She wants to get pregnant badly, but her periods are being seen twice a month. She's asking herself, how can she get pregnant when she sees her periods twice a month? Mukwano gwaffe ayagala kufuna olubuto naye ate periods aziraba emirundi 2 mu mwezi. Ali kwebuuza asobola okufuna olubuto oba nedda? Kyangu nnyo mukyalo nasobola okufuna olubuto. It's very possible for you to actually get pregnant when you see your periods twice a month, but the first plan would be you actually visit your doctor who will stabilize these periods. Okay, put you on medication to stabilize this period, to stabilize your cycle, so that it goes to once a month. And then, of course, more advice will be given on the next steps to take. The next step would be actually to do what we call ovulation tracking. Friends, I'm so sorry, they're doing constructions around here, so you'll bear with the interference. Bali kukola ebyokuzimba ne mujja kunsonyiwamuko. Yeah, tebitera kubeera bwe biti. Yes, so ovulation tracking. Ekirala kyasobola okukola, the next thing she can do is actually what we call ovulation tracking. Wow. So the next thing she can do is actually what we call ovulation tracking. Ovulation tracking means that if she sees her periods today, today is 5th of December 2026. And then maybe around the 5th, and then around maybe, let me see, around 16th, she sees her periods again. Basically, this will mean that she has what we call a short cycle. A short cycle. This will mean that she has a short cycle. Women with short cycles, women with short cycles, specifically what you need to do is, if your cycle is for like 16 days, if your cycle is for 16, we're going to proceed no matter the challenges. Okay, so if your cycle is for 16 days, if your cycle is for 16 days, what you need to do is you actually have to get 16, and then you go backwards 3 days. 3 days, okay? Meaning that on the 16th day, on the 15th day, on the 14th day, and then on the 13th day, you'll be with your partner beginning from the 13th day, 14th day, 15th day, and the 16th day. Okay, but still the best advice would be, you can try the ovulation tracking, but the best advice would be you actually visit your doctor, who will put you on medication to stabilize your periods. Okay, so your doctor will put you on medication to stabilize your periods, and then of course after your periods have stabilized, then of course you'll be able to get pregnant much more faster, because you'll be able to track your cycle very well. But still, if you have a shorter cycle, you basically have to track at least for 3 months. Okay, you track for this month, you get 16, and then you track again for next month, you get 17. Maybe you track for next month and then you get 15. Then you count 3 days backwards, and then of course you'll be able to actually get your best days of getting pregnant. But it doesn't hurt to actually go and do an ultrasound scan. It doesn't hurt to go and do an ultrasound scan from a hospital near you. Why? Because you could be getting the periods twice a month. Okay, you could be getting the periods twice a month when the problem is actually, you could be getting your periods twice a month when the problem is with the lining inside here. Remember this lining here, known as the endometrial line, okay, the endometrial stripe. It is regulated, or it is controlled by 2 hormones, estrogen and then progesterone. Okay, so if you're seeing your periods twice a month, then it could be an issue with either estrogen levels not balancing with progesterone, or progesterone not balancing with estrogen. Okay, the ratio of estrogen and progesterone could actually be unbalanced. Why? Because when you take a look at this hormone FSH, then you take a look at another hormone known as LOH. Okay, FSH and LOH. These hormones come from the brain. Sorry about the noise, but we have to proceed no matter the challenges. Yes, so the brain releases 2 hormones, that is FSH and LOH. When these hormones travel in the blood, this is the blood, and then they reach a woman's gonads, they reach a woman's eggs. FSH and LOH, FSH acts on that big egg which is mature, that big egg which is known as the dominant follicle. It actually brings about the growth of the eggs up to this stage, and then LOH also acts on this egg. Okay, basically FSH and LOH, they are the hormones that are actually the foundation of fertility. FSH and LOH, they are the hormones that are the foundation of fertility. I'm going to repeat in Luganda. Ngenda kudda mu Luganda. Yes, mukwano jange abali oke mu Luganda temugivaako live. So FSH and LOH, when they come in from the brain, they actually act on this egg here, which is known as the dominant follicle. I'm trying to bring about how periods become, or how a woman ends up with periods twice a month. Okay, so this egg, these two hormones, FSH and LH, after acting on a woman's eggs, this egg is going to produce hormones known as steroids. These hormones include estrogen and progesterone, okay? Yes, if you can hear me, please tap on the screen. Obanga ompulira tapping ku screen. Yes, kelele nyingi naye nga tapping ku screen okukakasa nti okyaliko oba ompulira bulungi. Yes, so the point is this. Estrogen hormone and progesterone are a direct result of FSH and LH. Estrogen hormone and progesterone hormone are the direct result of FSH and LH acting on a woman's eggs. Okay, I can see the hearts. Yes, thanks a lot for the support. So, why would the woman see her periods twice a month? If the brain is not releasing sufficient levels of FSH and LH, then it means that this egg will not produce sufficient levels of estrogen and progesterone. Then it means that a woman will end up with irregular periods or even periods twice a month or thrice a month. And that's why I was saying that our friend who is seeing periods twice a month first goes to hospital, and then her doctor, physician or endocrinologist will be able to actually find the root cause as to why she's seeing periods twice a month. So they will stabilize that. If it is an issue with estrogen and progesterone, they will stabilize that. If it is an issue with FSH and LH, they will stabilize that. And after stabilizing that, you will be able to see your periods. Your cycle will be normal. Wow. So your cycle will be normal, and then when your cycle is normal, that means that you will actually be able to track your cycle much more better. Then you'll be able to get pregnant. In Luganda, mukwano gwa government alaba periods emirundi ebiri nengamba nti mu bwongo bw'omukyala muvaamu hormone gye bayise FSH ne LH. Zino hormones ebbiri ye foundation eya fertility. Ze zitandika fertility journey. Why? Because wezijja mu mubiri gw'omukyala ne zituuka ku magi g'omukyala, lino egye ligenda okufuuka omwana lye tuyise the dominant follicle. FSH ne LH hormone weziva mu bwongo zikoona ku lineage. Okay, obutofaali babuyita theca cells and then the granulosa cells. Then zino hormones obutofaali obwo ne bufulumya hormones zino ebbiri, estrogen ne progesterone. FSH ne LH weziva ku bwongo nga zimala bulungi, omukyala ajja kubeera ne estrogen ne progesterone nga zibalansinga. FSH ne LH, wow. Okay, let's proceed. FSH ne LH weziba tezimala bulungi, then kiba kitegeeza nti estrogen ne progesterone era zijja kuba tezibalancing. Weziba tezibalancing, omukyala ajja kulaba periods emirundi ebiri oba emirundi esatu. So when you go to a hospital, they will address the root cause as to why estrogen is not balancing, why progesterone is not balancing, why FSH is not balancing. Then they will stabilize that, and then your periods will go back to normal. Wow, okay. Musao Shaban, yes, thanks a lot, Musao Shaban. Thanks a lot, Musao Shaban. Webale ku supporting, webale ku wagira. Yes, the noise is really a lot, but we have to stick around because, yeah, life is moving challenges, yes, but we have to proceed. Okay then, so next question, wanna get pregnant but my periods. Okay, next question, wanna get pregnant but my periods I've seen twice from my okay then, so I was saying that you first have to go and then they track you have to track your cycle first, or else you have to go and then they actually discover why your periods are appearing twice, and then you'll be able to be guided. You can also message me on WhatsApp, okay? Find my numbers in my bio. Prednisol and good in pregnancy. Okay, questions are there. Yes, come on WhatsApp and then we shall dig deeper on this. Yes, because there's some interference. Okay, seems like the questions are done. Oh, okay, we have some questions down here. I saw some question around here. I saw some questions around here. Friends, I'm so sorry about the noise. Yeah, they're doing some construction nearby, and I'm so sorry about the interruption. Mija kunsonyiwa ku noise, that interruption. Mija kunsonyiwa. Yes, so talk about Pcos. Patience, I've talked about Pcos. That was basically... Wow. I talked about Pcos. I said that Pcos is basically a condition known as polycystic ovarian syndrome. It's a condition which is actually evidenced by a woman having small follicles, small swellings on her ovarian tissue. Okay? Small swellings on her ovarian tissue. Ideally, a normal egg or a normal ovarian tissue. A normal ovarian tissue is supposed to have this shape with a big egg, which is supposed to actually be fertilized, or which is supposed to go on and become a baby, and then there should be some small eggs on the sides. We call this the egg reserves. They are waiting. When this does not get fertilized, then this will come, and then of course, so in Pcos, instead of having this structure, normally there's this structure here, okay? And then I also say that the best tests for Pcos have to be done in a hospital near you. These include an ultrasound scan. They include blood tests to check for your sugar levels, to check for your hormonal levels. Specifically, the hormones I'm looking at, the hormones I talked about include the androgens. These are male hormones, including testosterone, DHEA. And then, of course, your doctor could also advise on other hormones like testosterone, and then, of course, other hormones. And then after proper assessment, you'll be advised on the treatment. Your doctor will put you on treatment. Okay? Yes, I'm complimenting on what your doctor is giving you. I'm not replacing what your doctor is giving you. So you have to follow your doctor's prescription advice. And then also you can add on weight loss, lose some weight if you are overweight. Check your body mass index. If you're within the normal ranges, 18.5 up to 24.5, you're good to go. But if you're beyond 24.5, then look at ways of stabilizing this. Go to a nearby gym, and then your coach will actually advise you on the best exercises to lose weight for you as a woman. And this should actually include aerobic exercises, including skipping the rope, including mild jogging, and then also walking. We call this brisk walking. Begin slowly and then increase, build up the intensity with your exercises. I also say that in managing Pcos, you have to look at reducing what we call the high glycemic foods. Okay? Managing Pcos does not mean you take medication alone. It does not mean that you take metformin. No. You take your metformin, you take other medications, the inositors, but also you have to look at actually reducing high glycemic foods. These include bread, these include cakes, these include artificial sweetened foods which are available in supermarkets. Why? Because they are high in carbohydrates. And remember, carbohydrates, this formula here, can actually cause issues with Pcos. And then, of course, I said that the best diet. Okay, yeah, the noise is down now. We have to proceed. Yes, so I was saying that the best diet for a lady who is having Pcos is what we call the Mediterranean diet. The best diet for a woman with Pcos is what is known as Mediterranean diet. Yes, so Mediterranean diet includes a diet which is rich in plant-based foods. Get your potatoes from the garden, prepare them, put some greens, you're good to go. Do some avocados, you're good to go. Do some fish, you're good to go. Do some mukene in G-nuts, do pumpkin seeds. Message me on WhatsApp and then we shall talk more about what you're supposed to eat when you have Pcos, okay? Yes, next I talked about the signs of Pcos. I said they include irregular periods, they include insulin resistance. How can you confirm that a woman has insulin resistance? She checks for her sugars, and normally when the sugars are actually elevated, it could actually mean that the body is resisting the effects of insulin. And when insulin is not doing its work of converting glucose to glycogen, then it means she's going to have lots of sugars in her blood. Okay, so that was about Pcos. Let's go through the next questions. So, Piloya patients, I talked about Pcos and I've just done. Okay. The noise guy is back again. Okay, let's proceed. How can I conceive twins? The best way of actually conceiving twin pregnancy. How can a woman conceive twins? A commonly asked question. Very, very commonly asked question. First of all, the incidence of a woman getting twins is actually highest when there's what we call a family history of twins. Keep tapping on the screens, friends. If a woman has a history of twins in the family, then the chances of getting a twin pregnancy is actually higher, either on the side of the husband or on the side of the woman. If there's a history of twins in the family, then the chances are higher. Omukyala abeera ne history y'abalongo mu family, either ku side eya bbaawe oba ku side eya eyiye ng'omukyala, chances z'okufuna abalongo ziba nnyingi. That is naturally. It is a natural conception. And then twins can also be a woman can also get twins through what we call assisted reproductive technologies. Wow. The noise guy is not giving up, but we're also not giving up. So a woman can also get pregnant. A woman can also get pregnant through what we call assisted reproductive technologies. ART, assisted reproductive technologies. Omukyala asobola okufuna olubuto olw'abalongo ng'ayise mu kye tuyise assisted reproductive technologies. These technologies are very many, okay? Assisted reproductive technologies are very many. We have what we call the IVF, okay, in vitro fertilization. We have what we call the ICSI, intracytoplasmic sperm injection, okay? We have what we call the IUI, okay? Then of course we have the PGT. The IVF doctors will actually they will be able to guide you more about this, but we are basically covering a summary of it. So a woman can get twins naturally when there's a family history. She can also get twins when actually she undergoes what we call the assisted reproductive technologies. These include IVF, ICSI, IUI, and then of course PGT. But the best for twins, the best protocol would actually be IVF, and then of course ICSI. Mukwano gwa fabuza nagamba nti asobola atya okufuna abalongo naturally nengamba nti waba ina history y'abalongo kiba kyangu ku side y'omusajja oba ku side y'omukyala nengamba nti naye ate waliwo ne kyetuyise artificial reproductive technologies oba enzijanjaba eri ey'omuddwaliro omuli kyetuyise IVF ne ICSI. Of course baba basobola okubanga era bamuyamba mwene embeera n'abanga afuna olubuto olw'abalongo. Yes, I hope I've answered your question. Please keep asking more questions. I'm about to summarize. If there are no questions, we call it a day. It's been fantastic. We've talked about Pcos. Tomorrow or the next day, we could talk about something else, God willing. Doctor, I started periods yesterday. When will I get pregnant? Fantastic. She saw her periods yesterday. Yesterday was 4th of December 2025. She's asking herself, when will she be able to get pregnant? Mukwano gwa fabuze ekibuuzo nagamba nti yalabe periods jo nga 4 omwezi gwa December 2025, okay? Alikwebuuza ddi lwagenda okufuna olubuto. Okuddamu kino ekibuuzo kiri very simple. Tulina okusooka ne tutegeera cycle yo etambula etya. Okay? Cycle yo etambula etya. She said that she saw her periods yesterday. She's asking herself, when will she get pregnant? And I said that to answer this question, it's actually very important to know her cycle length. How long is her cycle? Why? Because if we understand the cycle, getting the day of getting pregnant is actually very easy. If her cycle is within 20 to 35 days, according to WHO, if her cycle is between this, or maybe if she has a 28-day cycle, then she just gets this date, that is yesterday, she counts like this. Okay, assuming that your cycle is a 28-day menstrual cycle, or maybe let's say 28-day cycle yo webanga yana kwa 28 waba yalabe periods jo lero nga 5, okay, 6, 7, 8, 9, 10, 11, 12, 3, 4, 5, 6, 7, 8, 9, 2, okay? So assuming that your menstrual cycle length is maybe 28, okay? And you are asking yourself, when will you be able to get pregnant? If you saw your periods yesterday, we shall actually count 14 days. If your menstrual cycle length is actually 30 days, we shall go up to the 15th day, okay? So, assuming that it is a 28-day menstrual cycle length, we shall say you saw your periods yesterday, that is 1, we call that day 1. The first day you see your periods, sorry about the phone rotating, I'm using both one hand to hold the phone, okay? If you saw your periods yesterday, we call that day 1, okay? And then we shall say 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17. Sorry. You'll excuse me, Banai. The noise is really a lot distorting me. Okay, let's go backwards. If it's a 28-day menstrual cycle, we count 14 days, okay? Let's go back, okay? Tetukowa. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. So if your menstrual cycle length is 28 days, then we shall actually say that on the 17th day, we shall count 3 days backwards, and we shall say the 17th day, first of all, is the day of ovulation. So we shall count backwards and say 1, 2, 3. So the days of you being with your partner, you have to begin being with your partner from here. That is the 14th day. You be with your partner here, meaning that he should also be prepared, okay, psychologically, and then of course he should be relaxed. Don't put him on tension that, you know what, we are supposed to have sex. No, do not force your partner. You should actually, fertility is more of a mind issue. You should actually be relaxed and then ready for this time. So it means that you'll be ovulating on the 17th day. So we count 3 days backwards. We count 3 days backwards, and then we shall say 1, 2, 3. So you say you'll be with your partner here from the 14th day, 15th day, 16th day, up to the 17th day. These are the days of getting pregnant. If your cycle is a 28-day menstrual cycle, okay? If your cycle is a 30-day menstrual cycle, oba omala nnaku asatu mu periods zo, then we shall go to 15 days, okay? We shall say 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Okay, Saturday menstrual cycle, do 15. 15 times 2, we come back to the Saturday menstrual cycle length. Okay, so we shall say the 15th day, which is 18th, and then we say 3 days back. We say you leave this day. Okay, most of our friends they ask, but do we begin counting from here? No. Count on the if it's a Saturday menstrual cycle day, count beginning from the 15th day. If it is a 28-day menstrual cycle day, a menstrual cycle length, just get 28 divided by 2, we shall get 14. So we shall say from here we count up to the 14th day, which is 17th. Okay, look on your calendar. I don't know when 17th is going to be. So be with your partner from here. The goal is this: an egg, when you see your periods today, an egg is going to take 7 days to grow, roughly. Okay, so 7 days to grow. Basically, from this stage to this stage, it takes actually 7 days. And then from here, to get a mature egg, which is going to be released on the 17th day, to get that mature egg, you have to add more 7 days. If you ask me, what is the science behind? What is the physiology behind? So basically, we have to get 7 days. And then, of course, after 7 days have elapsed, we shall have a mature dominant egg filled up with fluid. Amazzi, we call this follicular fluid, with a nucleus, with some cells on top, known as the theca cells and the granulosa cells, with all these other things, okay? So for this egg to be released, for this egg to come out and sit in the fallopian tube, awaiting fertilization, it takes 14 days. Why? We have to count from here up to here, 7. Here up to here, 7. 7 plus 7, we get 14 days. I hope it explains the 28-day menstrual cycle. Divide by 2, we get 14, which is 14 here. Hope I've not confused our friends. Yes, if you do have questions about how to track your cycle, please drop them. You can drop them here, you can drop them on WhatsApp, and then we shall be able to dig more on this. Yes, mikono gyaffe badde ndikwogera ku kubala ennaku nengamba nti cycle ebanga ya nnaku 28 kiri very simple. Tandika olunaku lwalaba periods zijjo. Nengamba nti tandika okubala ng'otandikira ku lunaku lwalaba periods zijjo, and then of course obale ennaku 14 nengamba nti 1 yagambye nti yalaba periods zijjo, ayagala kumanya ddi lwagenda okufuna olubuto, nengamba nti jjo zaabadde nga 4 leero nga 5. Okay, so tugenda kubala nga tugamba 1, that is olunaku olusooka, lunaku olwokubiri, lunaku olwokusatu, 1 2 3 4 5 6 7 8 9 10 11 12 13 14. Nengamba nti okuva wano nga 17 alina okubala ennaku endala 3 ngadda mabega, nengamba 1 2 3. So nengamba nti alina okubeera nebbaawe okuva nga 14 15 16 17 aba asobola okufuna olubuto. Wagezaako muzina ennaku n'atafuna lubuto, then kiba kitegeeza waliwo kye tuyise a big question mark. Wabeerawo ekiri okumulemesa okufuna olubuto. Eiza kiyinza okubeera ku ye ng'omukyala oba kiyinza okubeera ku musajja. Okay, then we are still proceeding with our live session. Remember to tap on the screen. Remember to like, to share. Remember to push our live, okay? Yes, so that we could actually Don Visa Expert, thanks for joining. Konkunda, Jonan, thanks for joining. Okay, then we have a question coming in from Zaki's Closet. Zaki's Closet, yes. Thanks a lot for the support, Zaki's Closet. Can I ovulate without seeing the egg white cervical mucus? Can I ovulate? Can a woman ovulate without seeing the egg white cervical mucus? Okay, omukyala asobola okulaba ovulation wadde nga talabye discharge enevaayo eringa eggi, okay, eringa office glue. Omukyala asobola okuovulate nga the short answer is yes. You can actually ovulate. It's not a standard. It's not mandatory that every woman is supposed to see the egg white cervical discharge. So you can actually ovulate very well. The only way or the best way to confirm whether you are ovulating normally at home is actually very simple. You need to visit a pharmacy. or clinic, but normally they are sold in pharmacies. You need to visit a pharmacy near you and then order for what we call the ovulation predictor kits. They're just like pregnancy test strips, but these are normally a difference. Why? Because they are different. Why? Because they are actually having this word LOH strips. They are actually having LOH, whereas the pregnancy strips, they do have HCG. Why? Because the ones for pregnancy, they look for a hormone known as the human chorionic gonadotropin hormone. This is a hormone which is actually produced when a woman is pregnant, okay? Specifically, when pregnancy has happened, this is a hormone which will be produced from a part inside the womb known as the decidua parietalis. Simply from the part where the placenta is attached. As the baby is growing in the early stages of pregnancy, there's going to be production of HCG. So the strips for pregnancy, they look for this hormone here, confirming that you're pregnant, 7 weeks pregnant, 8 weeks pregnant. The strips for checking whether you are ovulating, okay, whether you are ovulating well, they are known as the ovulation predictor kits, ovulation predictor strips. We call them ovulation predictor kits or ovulation predictor strips because they look for this hormone known as LOH, luteinizing hormone, because it's a hormone which is responsible for bringing about the bursting of that egg, which is actually going to be fertilized. Okay, so if you do the ovulation tracking and then you actually count your cycle, just as I've just counted for our friend. Let's say you are going to ovulate on the 17th day. And then you begin doing the ovulation tracking. You begin checking for ovulation early in the morning or around 10 a.m. in the morning. That's when that hormone is normally highest, okay? 10 a.m. in the morning. So when you begin checking your urine for the LOH or for ovulation, when you begin checking on the 14th, you check. Hope the phone is still capturing what I'm talking about. Yes, keep tapping on the screen. So if you check for ovulation on the 14th day, you check for ovulation on the 15th day, you check for ovulation on the 16th and the 17th day. You use the ovulation predictor strips on these days you are supposed to be ovulating. But the strip still shows you that there's nothing. There's only one control line. There's only that line which was there when you bought the strips. The second line is not there. Then it could actually drive to what we call an issue with ovulation. We could call this actually an ovulation. It means that this particular lady is having difficulties ovulating. Why? Because she has tested for ovulation at home. On the days she's supposed to be ovulating, the strips are not capturing the LOH hormone. They are not capturing. There's no second line here. If you do the ovulation tracking on these days here, okay, around 10 a.m. in the morning, that's when LOH is high. LOH hormone is highest. If you do the testing around this time, and then there's one big control, very thick line, but the second line is maybe kind of faint, you go up to around the 17th day when the mature egg has been released, but still there's a faint line. It could actually mean that still you are going towards what we call an ovulation. We call this an ovulatory syndrome. When you go to hospital, okay, then we are now in the hospital. So when you go to the hospital, your doctor will most likely add what we call a pelvic ultrasound scan. Or your doctor, if the service is there, your doctor could actually go for a transvaginal ultrasound scan. Why? To do what we call an antrofollicular count basically scan. Okay? Why? Why would your doctor do this? Because they really want to confirm. Do you have enough eggs that are growing? Are you having that dominant egg which is supposed to be fertilized, which is known as the mature Graafian follicle? Are you having that? If your doctor goes ahead and then does the ultrasound scan and still known as the antrofollicular count scan, normally this is done like for 3 to 4 days. Still it can be done within these days here. This day you do the scan, do the scan, do the scan, do the scan, and then your doctor will do the calculations. Then of course tell you whether your eggs are growing or not. If the antrofollicular count ultrasound scan has been done, okay, via transvaginal route, when the antrofollicular count scan has been done, and still there is no dominant egg, your ovarian tissue is just big like this, but with some small eggs around, then normally your doctor could actually go ahead and then confirm that you are having what we call an ovulation, also known as anovulatory syndrome. And then, of course, most likely your doctor will go through your blood work. Okay? Your doctor could go through your blood work to really confirm what is causing the anovulation. Are we together? Your doctor could actually go through the blood work to really confirm. Why are you not ovulating? Blood work for anovulation. If you ask me, blood work for ovulation, blood work for ovulation, what do you mean? What do you mean, Gerald Massa, the fertility coach? You're talking about blood work. What do you mean? Remember, my videos are for educational purposes only. Watch it, learn something, and then discuss more with your doctor for a personalized care plan. So most likely the ultrasound scan has shown that the antral follicular count is actually very low. No eggs are not growing. You've done the ovulation predictor test, OPK, ovulation predictor kit test. It's also showing that there's only one control line. The second line is not there. Your doctor will go through your blood work. Okay? Most likely your doctor would be interested in knowing about your FSH hormone. It's a hormone, my friend, okay? Yeah, your doctor will be interested in knowing about your FSH. The normal FSH, according to the World Health Organization, is supposed to be at least 3 up to 10, okay? International units per milliliter. I have videos about hormones after this live session. Kindly go through them. And then, of course, your doctor would actually also be interested in knowing about your LH hormone. Remember, it is the main hormone which didn't show up here. So your doctor will be interested in knowing about LH. Is it being released or not? Normal is supposed to be at least 2.5. In men, it should go up to 8. In women, it actually should go up to 12.5. You can confirm with this. You can confirm this with your laboratory or the hospital you're doing the test from. Me, I'm giving standards according to World Health Organization ranges, but your doctor could actually maybe say, your hospital could actually say maybe up to 13, maybe up to 14, okay? Always confirm with your hospital, yes, for these reference ranges. Your doctor could also be interested in knowing about the quality of your eggs. Normal AMH hormone is actually supposed to be 1 up to 4 nanograms per deciliters. And then lastly, your doctor could actually be interested in knowing about other pathways, other parts, like maybe your thyroid. Is it functioning well? Because we could be rotating on the eggs when the issue is coming from the thyroid gland in the neck. And then, of course, your doctor would actually also be interested in knowing about the male hormones. Okay? We call these the androgens. Okay? Yes. These androgens basically include DHEA. Dihydroepian androsterone. Is it high or it's not high? I will not give the reference ranges for dihydroepian androsterone because it's rarely tested, but still you can always message me if you need the reference ranges for this and what it means when it is high and when it is low. Yeah, because of time, I'm just going through very fast. Your doctor could also be interested in knowing about your testosterone. Normal in women, 0 up to around 0.1, but different hospitals give different ranges. So other tests can actually be requested according to your doctor's preference, okay? I'm not saying that this is basically, your doctor could add on other tests, okay? So the point is this. Once your doctor has the ultrasound scan, and then it is showing that the antral follicular count is low, the ovulation predictor kit test you did at home, it is showing that it is actually negative. The blood work will actually confirm. Why? Because the scans basically shows pictures, okay? But remember, the confirmatory is in the blood, okay? Many times the client is like, they've done several scans and they're not getting pregnant. What's the problem? Normally the issue is always in the blood work, okay? So, okay, I will be in Uganda later on. So, if the FSH results come out and then they show that your FSH is higher than 10, if 10 is the maximum, according to your lab. If the FSH results come out and they show that FSH is higher than 10, and LH is also higher than 10, keep tapping on the screen. If FSH comes out, it is higher than 10. LH is higher than 12.5. Maybe FSH is 30. Maybe LH is maybe in 40 or 50 or also 30. What does that mean? We shall also look at AMH. Is it within the normal ranges? If FSH and LH is higher than these ranges here, okay, then it could actually mean that the brain, go back here and then we see, the brain is here. The brain is sending lots of FSH and lots of LH. But as FSH and LH is reaching your eggs, your gonads, okay, this is the egg, the eggs, okay, the egg, yeah, one is called an egg. So as the FSH and LH is reaching the egg, it's actually, the eggs are failing to respond to the effects of FSH. So as the egg is failing to respond to the effects of FSH and LH, it means that the brain will say, what's happening with these eggs? They're becoming so stubborn. Let me send more FSH and LH. Again, the eggs will refuse. Why? Because they're of poor quality. The eggs will refuse. They will say, we are not going to respond. Oba you want, oba you don't want, send more FSH. So the brain will send more FSH, LH to the eggs. The eggs are stubborn. They are saying, we are not going to grow. That explains why FSH and LH will be higher than the normal ranges. I hope you are together. If the ranges come out and FSH and LH is lower than the normal ranges, lower than 3, LH is lower than 2.5. I hope I'm pointing to. Yes, if FSH and LH are lower than the reference ranges, it means that the brain is sending less FSH and LH. Why? It means that the issue could actually be around the eggs themselves. Maybe the AMH, remember AMH here? Normal is 1 up to 4. Maybe the AMH is actually maybe higher than 4. Because I said that AMH is supposed to be 1 up to 4. So if the AMH goes higher than 4, most specifically in the conditions like Pcos, then normally the brain could actually fail to send sufficient levels of FSH and LH. Okay, so when the FSH and LH is low, it could actually be an issue with either the eggs themselves or the brain themselves. If at all the results show that TSH, thyroid stimulating hormone, normal is supposed to be 0.4 up to 4.0. Okay, for more explanation on these pathways, please message me and then I will explain more on that. So if the brain is actually sending TSH, thyroid stimulating hormone, and then the TSH is actually higher than normal, it means that when it is high, there's also something happening in the brain. Why? Because we know that inside the brain, there's a hormone known as thyrotropin releasing hormone, TRH, thyrotropin releasing hormone. It is a hormone which brings about the release of another hormone known as TSH, which is actually here. So when TSH is high, it means that these centers will be affected. Some centers will be actually having an effect on the centers where FSH and LH is coming from. Okay, so I think I'm not going to overcomplicate that, but I think that's enough about ovulation and then why a woman will not be ovulating, and then about the days of ovulation. We know something about that. Okay, next question is coming to 7. Next question. Can I ovulate without seeing the egg white? Okay, I've just answered that question. Okay, it seems the questions are done. Yes, let's meet in the next session. And please remember, patience, thanks for appreciating. Remember to join me for any questions, any queries you need, fertility coaching. You need someone to coach you, need someone to advise you on the issues of, to guide you on the journey of fertility. I can actually do that very well. You can actually join me either on WhatsApp or you could come for the offline coaching sessions. Yes, offline coaching sessions, and then we shall be able to actually go, okay, talk about what has to be done to women with low sexual libido. Okay, low sexual libido. I think let's talk about this. Low sexual libido. When a woman has low sexual libido, the question is, talk about what tests to be done in a woman with low sexual libido. Yes, we know very well that for a woman to have good libido, basically the sex hormones. These include estrogen, these include progesterone, then these include LH, and then these include FSH. They have to actually be within the normal ranges. LH is known to actually be one of the hormones that actually makes the feelings to actually be much more higher, but specifically during ovulation. So when a woman has low sexual libido, first of all, much as we could look at the hormones and then all that, but we need to look at what could be the causes of low libido. You could realize that maybe the hormones are very okay, but when the low libido is coming from the mind, when it is an issue with the mind, maybe she's stressed. When a woman is stressed, same thing with a man. Okay, when there's lots of stress, it's very, very difficult to have good libido. So we need to address the possible causes of low libido, and then of course, after identifying what could be causing the low libido, if it is a hormonal issue, it can be addressed. If it is a stress issue, you need to actually manage the stress. But specifically, the tests that can be done to confirm why a woman is having low libido, they include estrogen, progesterone, luteinizing hormone, FSH. Okay, yeah, rarely the libido could actually maybe be coming from other things, but normally these are the standards. Most specifically the luteinizing hormonal test. Okay, because when you are supposed to be ovulating but your LH is low, it could actually explain why the libido is low. But remember, low libido could actually not be due to the hormones, but it could be due to stress. It could be due to other causes. Maybe you're not getting enough sleep. Maybe you are not having enough or sufficient time with your partner. Okay? Yes, because sex is basically 90% in the mind. Okay. Someone asked about sustain tablets. Sustain tablets, yes. Sustain tablets or capsules. Basically, sustain tablets or capsules, they do contain a hormone, artificial hormone, also known as a synthetic hormone, progesterone, in a weight of 200 milligrams. Okay, my videos are for educational purposes only. Yes, if you want a personalized care plan, you can always confirm with your doctor. You can always message me on WhatsApp, and then I'll be able to advise you more on what you could actually be taking. Okay, but basically sustain contains progesterone hormone, and this progesterone hormone is in a weight of 200 milligrams. But remember, there are other types of medications that do contain progesterone. These actually include duphaston, okay, also known as dihydrogesterone, in milligrams of 10 milligrams, okay. There's a reason why your provider could actually put you on progesterone of 200 and not duphaston of 10 milligrams. Normally, in women who could actually be having issues with their endometrial lining, okay, when the endometrium is not well formed, when the endometrium is actually not well defined. Endometrium is the inner lining of the womb. If a woman has issues with her endometrium or her endometrial stripe, okay, normally she could actually be advised on taking the progesterone or the dihydrogesterone, but this has to be guided by your doctor. Remember, this has to be taken beginning from day 21, okay? And then of course, you can actually take that for that period or for that time, which is actually known as the luteal phase. In women who have recurrent pregnancy losses, every pregnancy she gets comes out, normally her provider could actually advise her or put her on progesterone. Basically, it is very useful in women who have issues with their endometrium, in women who have issues with what we call repeat pregnancy losses, in women who have issues carrying a pregnancy up to term, okay? Okay, management of ED, wow. Management of ED, erectile dysfunction in men. I think that will be our next topic. Yes, because of time, I'll be able to dig more about okay, I've answered about the sustain tablets, capsules. Yes. I've talked about low sexual libido in women, and I've said that normally it is due to these hormones, the sex hormones. These include estrogen, progesterone, LH, and FSH. Normally, an imbalance in these hormones could actually bring about low sexual libido. And then I also say that the low libido could actually be due to stress. The hormones are very normal, but it's this stress which is causing this. Mkwano gwafe, let me go in Luganda. Mkwano gwafe abuza nagamba nti okay, ku hormones agambye nti hormones zino ziba ziyamba ki oba zikola ki, nengamba nti hormones zino ez'enjawulo ziyambako okulaba nti at least system y'omukyala etambula bulungi. Nengamba nti hormone gye bayise FSH hormone normal zina kubeera 3 up to 10 era ziyambako okulaba nti amagi g'omukyala gakula bulungi. Nengamba nti LH hormone gye tuyise luteinizing hormone eyambako okulaba nti omukyala agenda bulungi mu ovulation, omukyala abeera ne feelings, omukyala afuna olubuto amangu kuba egiri balikula bulungi. Then nengamba nti hormone gye bayise AMH eyambako okulaga omutindo ogw'amagi guli gutya. Normal erina kubeera 1 up to 4. Naye ate kisinzira ku ddwaliro gy'oba okeberedde. Nengamba nti omutindo gwa AMH oguba gulinnya nga guli waggulu wa 4, omukyala ayinza okuba nga alina ekirwadde kye tuyise polycystic ovarian syndrome, oba wabanga abadde ali mu 5 oba mu 6 ayinza okuba nga alina ekirwadde kye bayise polycystic ovarian morphology, stage esooka ng'omukyala tanafuna Pcos. Nengamba nti dokita we asobola okukebera ne hormone gye bayise TSH okulaba ku lwaki omukyala tali ku ovulatinga obulungi, era TSH hormone normal erina kubeera 0.4 up to 4.0 okusinziira ku kitongole eky'ebyobulamu kye bayita the World Health Organization. Nengamba nti singa TSH efuna obuzibu n'erinnya n'egenda beyond 4 kiba kitegeeza waggulu eri mu bwongo wayinza okuba nga waliwo obuzibu. Okay, then webanga eri wansi wa 4 then kiba kitegeezera still wabeerawo issues. Jukira hormone gye bayise TSH etambulira wamu ne hormones ze bayise T3 ne T4, zino ze bayise the thyroid hormones. Mwe muli ne hormone gye bayise calcitonin naye ngene eddiringa ne calcium regulation mu mubiri gw'omukyala. That's why olaba nti mu biseera ebisinga abakyala abasinga bali ku lugendo lw'okufuna olubuto batera nnyo bateramu ku treatment nga mulimu okone ku calcium oba nga mulimu okone ku vitamin D3 ayina ekinene ennyo kyaba ayambako dokita wo aba agenda kugaidinga ku ekyo. So nenjogerako ku mukwano gwaffe n'abuuza ku lwaki omukyala abeera ne low feelings oba feelings nga talina bulungi okuba nga abeera ne bbaawe. Nengamba nti ebiseera ebisinga kiyinza okuba nga kiva ku hormones zino ze bayise the sex hormones omuli kye tuyise estrogen, progesterone, LH ne FSH. Nengamba nti ayinza okulowooza nti obuzibu buli ku hormones naye nga hormones tezirina buzibu bwonna naye nga ate obuzibu buli kuva ku mind ye nga tateredde bulungi mu mbeera eyo kubanga abeera stressed ennyo. Waba ali stressed ennyo feelings tezigenda kubeerawo. Nengamba nti singa afuna obudde obumala n'abeera ne patana we n'abeera ne bbaawe na opening up n'amubulira ki ekiri omutawaanya ne bakyogerako feelings zisobola okudda nga wadde tamiza wadde nampeke. Naye of course wagezaako ne bigaana then kiba kitegeeza abalina ogenda mu ddwaliro ne baba nga bazuula ku lwaki feelings ze zigenze. Mukwano gwaffe mulala n'abuuza nti sustain oba kye tuyise progesterone tablets oba capsules ziyamba ki. Nengamba nti progesterone capsules ziyambako ennyo mu mukyala abadde alina obuzibu ne layini eno ey'omunda nga tefoominze bulungi oba nedda nga alina history ey'okuba nga avaamu ennyo embuto kye tuyise repeat pregnancy losses. And then of course nengamba nti ebiseera ebisinga mulimu ebika ebirala eby'empeke ezirimu progesterone omuli kye tuyise dufaston, erina ekika ekya progesterone kye bayise dihydrogesterone. And then of course yo ekika kya progesterone alimu wa 10 mg, then zino ze bayise sustain za progesterone owa 200 mg. Naye nengamba nti omusawo we aba asobola omugaidinga ku bibuuzo byonna byaba alina ku issues eza fertility. Okay, Nunu said, thanks a lot. You've said that I talk about abdominal wall endometriosis. Abdominal wall endometriosis. Mukwano gwaffe abuuza n'agamba nti njogere ku kye tuyise abdominal wall endometriosis. First of all, what is the meaning of endometriosis? This is the lining of the uterus. I like drawing this diagram for clarity. And then of course in here is that line where the baby is supposed to grow from. We call this the endometrial line. I think by now you know this, okay? We have the fallopian tubes, we have the ovarian tissue. System y'omukyala eri wet, amagi, and then of course ekisawo ky'amagi, enseke zizino, and then of course line omwana gy'akuliramu yeeno. Omukyala abuuza n'agamba nti njogere ku kye bayise abdominal wall endometriosis. Abdominal wall endometriosis. Endometriosis simply means that part of this tissue that is actually supposed to grow from inside here has gone on outside and it is growing from another part. Basically it's growing. This tissue here is growing from outside the uterus. It's either growing in the tubes. This tissue is either growing in the cervix. This tissue is either growing in the, I don't know whether it can also grow in the private parts. I've not read anything about that. So this tissue can actually grow in the abdomen or in the intestines. Like in this condition, she's saying that I talk about abdominal wall endometriosis. This simply means that part of the endometrial lining, part of this tissue is actually growing along the abdominal wall. A very painful condition. Why? Because as a woman is going in her periods, as a woman is menstruating, because it is this same tissue which is normally shed in form of periods. Whenever she goes in her periods, when this tissue is also growing in the abdomen, okay, in the intestines, then it means that she will also be seeing her periods in the intestines or in the abdomen. Why? It's actually why it's called endometriosis. It's a very painful condition. So she said that I talk about abdominal wall endometriosis, and I think in summary, basically it means that the tissue that is supposed to grow from inside the uterus is growing from outside the uterus. Abdominal wall endometriosis kitegeeza nti akawabi kano ak'ennyama k'omunda akalina okukulira munda mu nabaana kakulidde mu nseke oba kakulidde mu byenda. Kati nga mweno condition mukwano gwaffe abuuza n'agamba nti njogere ku abdominal wall endometriosis, n'engamba nti kiba kitegeeza nti ennyama eno erina okubeera munda mu nabaana, erina okufuuka periods egenze erikukulira mu byenda. Basobola okumujjanjaba, basobola omumanaginga, naye okujjanjaba kulina kubeera mu ddwaliro. Management of endometriosis has to be in a hospital, preferably a specialist women's hospital. You can actually find a specialist women's hospital near you, and then your doctors will be able to take you through a proper blood work. And then of course, your doctors could also do proper radiological tests, including an abdominal CT scan. Abdominal CT scan to confirm how far the endometriosis has gone, okay, in growing in your abdominal region. So normally your doctor could actually look at what we call a CT scan, okay, CT scan. C means computerized. T stands for tomography. Tomography are those many pictures which will be shown on that scan. Of course, scan, we know scan, okay? Pictures being displayed of your body, of your system, okay? So normally your doctor could actually order what we call a CT scan. And normally CT scans are divided into two. We have those that are actually contrasted, and then we have the non-contrasted. Non-contrasted is the commonest. Contrasted, in some cases, it can also be done. Mkwano gwa fabuza nagamba nti abdominal wall endometriosis basobola ogikebera batya, nengamba nti alina okugenda mu ddwaliro lye bayise a specialist women's hospital, and then baba basobola okuba nga bakola tests ez'omusaayi okulaba hormones ziri zitya. Then of course basobola okukola ne tests ez'ebifaananyi ze tuyise radiological tests, omuli test gye tuyise a CT scan oba computerized tomography scan. Eba egenda kukuba ebifaananyi ebya system ye bingi nnyo. Ekipapula kino ekya scan ekya CT kiba kinene nnyo weekiti, naye kibeerako obufaananyi bungi nnyo. Ndoza wali okirabyeko obanga maybe omuntu ng'afunye akabenje bakola gundi eyo. Eba kifaananyi kinene weekiti naye nga kiriko obufaananyi bungi nnyo nga kuliko ne different of course pictures. Doctor wo tumuyite a radiologist aba asobola okuvunula ebifaananyi ebyo, then of course n'abiteeka ku report, then of course n'agayidinga ku okulaba nti kino ekirwadde kya endometriosis kituuseewa. If this is the abdominal wall and then this is the umbilicus, the umbilical cord, specifically you could actually realize that maybe if at all the uterus is around here, okay, yes, if the uterus is around here, of course with the private parts, okay, with the cervix here and then the lining is here. Now this tissue, which is known as the endometrial tissue, if at all it has moved from here and then it is growing in the abdomen, the CT scan is the best scan, okay? You could say, isn't it okay like they do a transvaginal ultrasound scan? No, CT scan is the best because it gives a complete picture of the whole abdomen. It actually gives clear images of the whole abdomen. It can actually be used to track and see how far the endometriosis has actually moved along the system, okay? Okay then, seems the questions are done. Okay. Have a question. Yes, you can actually ask if you have that question which is burning. You can actually ask. Yes, if you're not okay asking the question here, you can actually get my numbers on my bio, and then you could actually message me. Yes, but I'll be replying tomorrow because of the busy schedule. But you can put your questions there. You be patient. Oba misinzo okubuza ebibuuzo sobola okubanga ofune number ku bio n'obuuza naye nja kuddamu enkya. Yes, kuba mbadde nkyali busy leero. Yes, so okay. Godfather nkutumiddeko. Yes. yes, Godfather nkutumiddeko, I'm your fan, okay, Godfather, yes, omulimu gwo nguwagira nnyo, yes, webalire ddala, nzo of course mbadde ndi ku summarizinga, naye nga nkutumiddeko Godfather, webalire ddala okuwagira omulimu, yes, so tests recommended to be done in men with ED. Thanks a lot. Tests esobola okukolebwa mu musajja wabanga abadde alina obuzibu obwa ED, erectile dysfunction. Erectile dysfunction. What are the tests that can be recommended? Number one, remember my videos are for, my live sessions are for educational purposes only. Okay? Kusomerako busomi, nenga you have to actually confirm with your doctor, but these are the commonest tests that can actually be done in a man who actually has ED, erectile dysfunction. Ng'omusajja alina obuzibu okubanga afuna erection. Okay? Ate wabanga agifunye, wabanga ayimye, wabanga afunye okuba nti afunye amaanyi g'ekisajja, talwawo. Aba yakayingira bw'ati mu mukyala we, kasaafunako bw'ati ebbugumu, immediately ng'amalirawo. Ate okuddamu okubanga asobola okufuna an erection, okuddamu okuyimirira kiba kizibu. Erectile dysfunction simply means that a man has difficulties getting an erection. Okay? The first step is getting an erection, lutalo. Okay? Needs lots of, he has to be stimulated, he has to be romanced for a very long time. And after romance has taken place and after he has got that erection like this, if at all he tries to change position in the bed like this, maybe to move from one side of the bed, okay, this is the bed, maybe he tries to move from this side to go to this side, the erection drops. You get the point? Anything small, maybe the phone rings like this, the guy is erecting very well, okay? But when the phone rings like this, okay, immediately he maybe answers that phone like this. Ideally, the erection drops. Anything small can actually make him to actually drop, to lose the erection. Now, after the erection dropping like this, getting another erection, it becomes a tug of war. He will just say, I'm sorry, I'm sorry, I'm sorry, I'm sorry, I'm a man, I'm telling you, these are real issues. If you're a man and you're on this live session, this is a serious topic. So he begins apologizing to the lady and then of course he goes to sleep. We call that erectile dysfunction. Getting an erection is very difficult. And after getting the erection, normally maintaining that erection for like 30 minutes, or even 1 hour, or even throughout the activity, throughout the game, it becomes an issue. What could be the causes before we talk about the tests? Biki ebisobola okubanga bireeta omukyala okubanga okufuna amaanyi g'ekisajja kiba kizibu n'okumaintaining amaanyi g'ekisajja kiba kizibu? What are the causes? Number one, I will not forget to talk about stress. When a man is stressed, maybe the stress is coming from work. Maybe the stress is coming as a result of finances. Maybe the stress is coming as a result of maybe lots of feelings. Okay, you be together with a partner, you be together with your partner 10 years, 20 years, 30 years, and then the feelings drop because you've done the same style. You do the same things in the bed. You visit the same places. So when the feelings go down, the erectile dysfunction can actually come out. Erectile dysfunction, which is a result of stress, which is related to stress, we call this psychogenic erectile dysfunction. Now, you may say you want to get treatment for erectile dysfunction and yet you just need to work on your mind. You just need to work on the finances. Get the money in the pocket. When your wallet gets the good money, like the erectile dysfunction goes away. That is psychogenic erectile dysfunction. Okay, you work on the issues of the feelings. You try to visit new places. You renew your love. The psychogenic erectile dysfunction goes away. You maybe, if it is due to diet, you're not eating things that are high in zinc. You begin eating pumpkin seeds. You begin eating watermelon seeds. Okay, they contain that stuff which is actually converted into nitric oxide. You begin working on your diet, the erectile dysfunction goes away if it is psychogenic. And then, the erectile dysfunction, if it is due to disease, you can actually tap on the screen to confirm that you're still on the live session. So if the erectile dysfunction is due to disease, maybe due to infections, eating along the tube, okay, your urethra, maybe the infections are going to the testes and ensigo. They've eaten, okay, the ensigo, the factory where the sperms are made, okay, and then maybe they have also destroyed those cells which actually are responsible for producing a hormone for men known as testosterone. Yes, keep tapping on the screen. Yeah, so if the infections have gone along the way and then they've destroyed the centers where the sperms are being produced from, and then the man is having low testosterone due to infections, then you actually have to work with your doctor who will correct that infection, who will treat that infection. A simple test known as a urine culture and sensitivity test will be done on your sample of urine, okay? Or other tests like maybe the blood culture can also be done. Or other tests like the urine analysis test can be done. An ultrasound scan can also be done. Okay, let's do the tests now because our friend asked for the tests. Mukwano gwaffe abuuza nti biki tests esobola okukolebwa ku musajja azuuliddwa nti talina maanyi ga kisajja bulungi oba tasobola kubanga kwegamba lastinga mu kisaawe. Kuba oyinza okudduka n'omira empeke eza Viagra, sildenafil citrate. Oyinza okudduka n'omira Viagra n'omumira ate n'akoonoona. If you have erectile dysfunction, do not rush for the Viagra, do not rush for the medications. Because you could be handling a symptom and yet the root cause has not been handled. Okay, I always advise identify the root cause. Talk to your doctor who will guide you, who will discover the root cause of why you're getting the erectile dysfunction. Because it could be actually psychogenic. It could be your mind. Okay, maybe you've lost feelings for your partner. Okay, you just need to work on that and then the feelings come back and then you can actually perform well in bed. Okay, yes, so if it is diet, you work on the diet. So what are the tests? Biki ebisobola okubanga bikolebwa oba tests ki ezisobola okubanga zikolebwa okubanga omusajja alina kino ekituyisa erectile dysfunction ayambibwa? The first test is actually the hormonal test known as FSH, follicle stimulating hormone. The next test is known as the LH test, luteinizing hormonal test. There's always a reason why I'm talking about these tests. There's a reason why these tests are done. So you can actually do the FSH test. Your doctor will do, not you. Your doctor will do the FSH test, and then your doctor will order for the LH test, and then your doctor will also order for what we call a scrotal ultrasound scan. Scan ey'ensigo zo, okulaba ensigo zo ziri zitya. What is the volume of your testes? Is it within the normal 14 up to around 25, okay, mils? Or your tests are very small like beans, okay? And then is there water, is there fluid in your testes? Are you developing a hydrocell? The epididymis, how is it? That part where the sperms are stored before they are released into the woman during intercourse. And then, of course, the other test to rule out infection is actually known as the urine. I've just talked about this, urine culture and sensitivity test. The other test is actually known as the urine analysis. Very common in clinics, but the urine culture and sensitivity is much more clearer and it's much more accurate. So, of course, this is also good, but this actually brings about a detailed report. And then the other tests for erectile dysfunction, of course, they will actually include therapy. No, sorry, I'm talking about management. So the tests are FSH, LOH, scrotal ultrasound scan, urine culture, and sensitivity test. I hope I've not left any other tests. Let me see. Which other test? Yeah. I'm not so sure about the mental state exam whereby maybe your doctor could actually do a proper clinical history, taking on you to really assess is the erectile dysfunction due to mind issues, stress issues, but that can also that can always be done during the history taking, okay? Yes, but these are the standards: FSH, LOH, scrotal ultrasound scan, urine culture. I've forgotten a test. Yes, it's called the sperm analysis test. Sperm analysis test. Why? Because the sperm analysis test can actually also give a detailed report on how your sperms are. The heads, are they normal? The neck of the sperm, is it normal? The tails, are they okay? And then the shape of the sperms, is it actually very normal? We call this sperm morphology. Do you have cells known as leukocytes? These are white blood cells. Are they being shed in your sperms? Do you have blood cells in your? Do you have blood in your sperms? Do you have pus in your sperms? Much as the urine culture can show, but when you correlate urine culture test, urine culture and sensitivity test with the sperm analysis test, your doctor will actually have a proper working plan. So mu Luganda, mukwano gwaffe abuuza n'agamba nti tests ki esobola okukolebwa ku musajja alina kye tuyise erectile dysfunction, ne ngamba nti test esooka yene ya hormone gye bayise FSH, follicle stimulating hormone, eyokubiri LH test, eyokusatu scrotal ultrasound scan, and then nengamba nti ne urine culture naye esobola okukolebwa, ne sperm analysis test esobola okukolebwa. These are the standards, these are the basics, but remember, your doctor can always add on more tests, or even they could decide to actually maybe do 1 or 2 tests, but this is a complete guide. You could ask yourself that now, Gerald Massa, the fertility coach, you've talked about FSH, LOH. What is the rationale? Why are they testing for FSH and LOH? It's very simple. In your brain, in our brain, as men, in the brain, these hormones are actually released. We call these gonadotropins. They travel to the man's testis. FSH and LOH travels to the man's testis. I don't know whether the phone is moving a lot. You're not seeing very well. Yeah, but later on we shall get something to hold the phone. Yeah, we shall get something to hold the phone. I'm so sorry about that. First it was the noise, now it is the phone moving. Okay, so the brain of a man releases two hormones, FSH and LOH. FSH and LOH, they are hormones known as gonadotropins. When they move through the blood to the man's testis, they go to some special cells known as the Sertoli cells and the Leydig cells. FSH brings about the whole process of sperm production. We call this spermatogenesis. LOH brings about the production of a hormone known as testosterone. Okay? Now you see that erectile dysfunction is a big issue. It's not just about taking Viagra. Musawo mpaya akaweka akakatano, akaliko ekigamba 5. Musawo mpaya akaweka akaliko ekigamba 25. You get the point, eh? You actually oyinogenda mu ddwaliro ne bakola all these tests. Kuba oyinza okumira Viagra ate n'akwonoona ate nga wali osobola okuyambibwa. So FSH and LOH is a hormone ezigenda mu system y'omusajja ne zireetera okubanga omusajja abeera n'enkwasa ezimala obulungi kye tuyise sperm production. Ne zireetera omusajja okubanga abeera ne hormone gye bayise testosterone ng'emala bulungi. FSH and LOH, they bring about sperm production, they bring about testosterone. I'm over repeating so that we understand these things. Okay? Yes, I'm over repeating. I could go very fast, but I need to repeat so that we understand. FSH and LOH brings about sperm production and testosterone production. Okay? Keep tapping on the screen. Yes, so if at all a man is having erectile dysfunction, how is FSH and LOH related to erectile dysfunction? If FSH and LOH are low, then it means that the sperms are actually going to be low. If FSH and LOH is low, then it means the testosterone is going to be low. And we know very well that testosterone hormone is actually a hormone for men. It gives us energy. It brings beards. It makes us to be masicula. It makes us to have kanyama. You get the point? So it also brings about to energy in the bedroom. You get the point? So if FSH and LOH are low, then the erectile dysfunction could be due to insufficient production of testosterone or sperm production. But specifically testosterone, precisely. Next, how does the scrotal ultrasound scan help in a man who has erectile dysfunction? How will a scrotal ultrasound scan help? Scan eyensiga ez'omusajja ejja kuyamba ki? It can help to show. Okay, we continue. Keep tapping on the screen. Scrotal ultrasound scan. Scan eyensigo ez'omusajja. These are the testes. These are the special cells inside. Special cells. This is the sac, known as the scrotal sac. This is the, the phone is now stable. This is the tube, which is on the side of the testis. This is the tube. Vas deferens go like this. The penis is here, okay? So, when a man who has erectile dysfunction, ED, goes to hospital and they do the ultrasound scan of the testis, the scrotal ultrasound scan, the scan will actually give a clear picture of this part here, known as the epididymis. Is it normal? Is it swollen? Is it filled up with things, okay? Or there are issues around here. The blood vessels, are they kind of like swollen? We call this varicocele, these blood vessels around this area. The scrotal ultrasound scan will actually give pictures of the testes, okay? The testes. Are they within the normal ranges? Are the testis, the testicular tissue, is it normal? Or there's fluid which is collecting? Are there some swellings? We call these cysts inside with the man's performance. The next thing the scrotal ultrasound scan shows is that it will give clear pictures of the prostate gland. The scan doctor, sonographer, the doctor who is doing the scan will actually measure the volume of the prostate. If the volume of the prostate is within the normal ranges, then the doctor will conclude that the prostate is okay. If the volume is high, then it could actually mean that maybe the erectile dysfunction is due to the enlarged prostate gland. We call this prostate hyperplasia, benign prostate hyperplasia, BPH, benign prostate hyperplasia, which could actually be due to either infections, which could be either due to maybe issues happening in the prostate whereby the tissues are growing at a very rapid rate. Your doctor will actually be able to guide you on this. The other relevance of doing the urine culture and sensitivity test to rule out whether there are infections that have eaten this tube, that have eaten the epididymis, that have eaten the testes, and thus preventing the normal production of sperms or preventing the normal production of a hormone known as testosterone. I think that's enough about testosterone. Okay, I have a question. Okay, it is 7. It is 7 banai. Okay, thanks a lot all our friends who were on this live session. Mikono jafa babaddeko ku live eno. Yes. Mikono jafa babaddeko ku live eno, including Foster, Godfather. Yes. Inkutomideko, Grace Lumesa, thanks a lot for being on this live session. Yes, by the grace of God, we shall get some time again and then go on live again, either tomorrow or the next day. Yes, but thanks a lot for the support. I'm really so humbled. Mikono gwanga baddeko ku live session. Inkutomideko, bampita Gerald Massa, the fertility coach. Okay, obango badde webuuza naye musawo nga tetumulaba, musawo kyono Gerald Massa, the fertility coach. Fertility coaches are very relevant. They are very necessary because they do guide you on your journey of fertility. Okay, my advice is that I'm not replacing your doctor. Okay, don't say now you're going to replace my. No, I'm not replacing your doctor, but I can teach you. The word is teach, keyword. I can teach you about your fertility, guide you on your fertility, advise you on like the missing gaps. You tell you you're taking this, but there's something missing, okay? Do this, add on this, okay? I can guide you on your fertility journey. Of course, complementing on what your doctor is actually guiding you. And then, of course, together as a team, we can actually achieve the goals. The goals are, if you're trying for pregnancy, you can actually get pregnant much more faster when you have someone guiding you. That someone is called a fertility coach. So fertility coaches are actually much more. There are so many outside our country, but still also in our country, Uganda, fertility coaches are coming in. And remember, fertility coaches are already clinicians, but they go on and then they actually do specify, they do specialize in fertility coaching. Like I'm certified by the American Society for Reproductive Medicine, that is in the US. And then of course, I'm also licensed to practice in Uganda as a registered nurse. So you can always advise me. I mean, you can always ask your questions. I'll be able to advise you, guide you. And then, of course, that's enough for today. If you do have any questions, if I've missed answering your question, please find my numbers on my bio. I'll be able to guide you. Have yourself a fantastic day. Let me see you in the next video. Bera bulungi kankolabe mu next video, kankolabe mu live session edako. Omukama akuume, omutonzi waffe akuume. Bye bye.